Good morning, everyone. Good morning, everyone. If I could ask you to take your seats so we can begin, please. Thank you. Thank you. Good morning, everyone. I am the Board Secretary for the Board of Health, and we have quorum. I will call the first meeting of the Board of Health of the 2022 to 2026 term to order. Welcome to members of the board and to members of the public. You can follow the agenda and debate on your computer, tablet, or smartphone at toronto.ca/council. The Board of Health acknowledges that the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Members, are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and nature of your interest. Okay, seeing none, I will proceed to the first item of business, which is item HL 1.1, election of chair for 2023. We do have one speaker on this item, so I will ask them to now come forward. They will have 5 minutes to speak. The first speaker is Daniel Freyheit.
Good morning. Not sure if my video is on. Let's see if I can start my video as well.
Yes, please go ahead.
Oh, there we are. Thank you. Good morning, honorable members of the board and incoming chair. As you probably know, my name is Daniel Frey, and I do a lot of advocacy on Twitter about best practices for COVID vaccine rollouts. And in that capacity, I acquire a lot of information from people across Canada and Torontonians in particular about how their lives have been impacted by vaccine mandates. I just want to speak briefly to the Board of Health and the incoming chair, who I understand is being voted in as this first item. As this board and the incoming chair probably know, many companies across Toronto continue to have COVID vaccine requirements as a condition for employment. It's often found in job postings, but in some situations it's thrown on individuals during a job interview. We know that during COVID, the role of the chair was used to promote and encourage vaccines for all Torontonians, including third doses. This communication by the chair was used as part of an overall promotion of health and well-being for all Torontonians, which is consistent with the board's mandate. As the City of Toronto continues to witness so many companies exclude unvaccinated individuals from employment, I would respectfully ask this board, and especially the incoming chair who's being voted in today, to consider the possibility of raising to the public's attention that vaccine requirements as a condition of employment are no longer necessary and in fact may be doing more harm than good. Ever since Dr. Moore around this time last year and Dr. Tam a month later, or shortly after, pointed out that given the different the variants that were escaping immunity, vaccine mandates were not going to be effective to stop workplace transmission. And I've been trying to raise awareness about the harms being caused by ongoing vaccine mandates at companies and even some government institutions, for example, the CPSO. I would respectfully ask the incoming chair and those who are voting today on the chair to keep this issue in mind, to vote for a chair who is prepared to make direct and indirect communications available to companies in Toronto, Toronto-based government agencies, to recommend vaccines, but to not build a segregated society around them. It's not in the interest of this board's mandate, and the incoming chair can and should use their role to drive this message home. And if you have any questions, I'd be pleased to answer them. Thank you for the opportunity to speak today.
Thank you for your remarks. Directors, do you have any questions for the public speaker? Okay. Thank you, Mr. Freyheit.
Thank you.
We will now proceed with conducting the election of the chair. Members, are there any nominations for Chair of the Board of Health? Members may nominate candidates, including themselves, and nominations do not require seconding. Director Mantis?
Through you, Madam Clerk. Good morning, everyone, colleagues, staff, and members of the public. I would like to nominate Councillor Chris Moyes as Chair.
Thank you, Director Mantis. Director Moyes, do you accept the nomination?
Yes, I do.
Thank you. I am calling for nominations a second time. Are there any further nominations for Chair? I'm calling for nominations a third and final time. Are there any nominations for Chair? Hearing no further nominations, I declare the nominations are now closed. As Director Moyes is the only nominee, I declare him the Chair of the Board of Health for a term of office starting January 16th, 2023, and ending December 31st, 2023, and until a successor is appointed. I will now ask Director Moyes to assume the chair in order to conduct the election of the vice chair and the rest of the meeting's business.
Before I start, I'd just like to make a few remarks to thank everyone. So thank you thank you to all my colleagues for electing me Chair of the Board of Health. As a former addictions counselor at St. Mike's Hospital, I know firsthand how important it is for Toronto Public Health to be responsible and proactive. We are here together to shape Toronto's public health, which in turn helps to shape our city. We all realize that the work of the board doesn't stop at COVID-19. We're seeing widespread mental health crises throughout our city, and we cannot ignore how poor public health measures can affect the safety of our community. I will chair the Board of Health with respect and tact. I promise to work together with members to build consensus and understand our city's realities. The interconnectedness of the issues we face as a city is not to be ignored, and I believe the other members of the board will join me in strengthening Toronto public health. So thank you so much for allowing me to say those few words, and we will start. So before we continue with the second item, I would like to go over the administrative details for this meeting. Today's meeting is being held with board members as city staff, participating both by video conference and in person at City Hall in Committee Room 1. City Hall is open to the public, and anyone is welcome to attend the meeting in Committee Room 1 at City Hall today. The public may continue to participate electronically by video conference. This meeting is also being live streamed online at youtube.com/Toronto City Council Live. I also ask everyone for their patience with any delays and technical issues. The last few weeks we've had some issues, so hopefully today will be fine. The clerk's office will connect remote registered public speakers to the meeting by video conference. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has also emailed the speakers list to the directors. Directors, this is a paperless meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or speak. I will then create a speaking list and will call on directors when it is their turn to speak. When voting on an item or motion, I ask the directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. So our second item on the agenda is HL 1.2, election of vice chair for 2023. Is there anybody here to speak on the item? Seeing none. Members, are there any nominations for vice chair? Councilor Perks?
Yes, I'd like to nominate Councillor Alejandro Bravo as vice chair.
Okay. Councilor Bravo, do you accept the nomination?
I do, Chair.
Okay. Are there any other nominations for vice chair? Going once? Going twice? And Councilor Bravo, congrats. You've been acclaimed vice chair. I didn't follow my script for that one. New item of business. I will ask the board secretary to display the item so that directors can review it before voting on whether or not to add it to the agenda. So let's display that. So the new business item is cold weather and the effects on those experiencing homelessness. May I have a motion to add this item to the agenda as new business? Councilor Malik, all those in favor? All those opposed? That's carried. So the new business is item number HL 1.6. Members, just as a reminder that the clerk's office has advised us that there are a large number of communications received on this item, and they are working hard to proceed and distribute these communications. Okay. So. Thank you. So let's proceed with the agenda reviews of the remaining items. We will now consider the items that were held. Okay, we will start with item HL 1.3, update on Toronto's respiratory viruses season. Okay, there's a presentation. So we'll hold that. We will then hear from any registered public speakers, if any, before moving it back to the board. Actually, we're not here yet, are we? There's no speakers for that, right? Okay. So what's the agenda for that? All right, thank you. I haven't, okay, so items HL 1.1 is being held. Items HL 1, yes, we've done that. 1.3 and 1.4 being held for presentation. And items, number 5 held? Okay, items 1.6 will be held for speakers. So items 1.5, we can vote on that one. That one's not being held, and there's no speakers for item 1.5. We have a mover for that. Councillor Malik. All those in favor? Excellent. Okay. 1.3. Okay. So we'll start with items 1.3. Update on Toronto's respiratory virus season. So Dr. De Villa, the floor is yours.
So thank you, Mr. Chair, and good morning, everybody. It is a pleasure to see you all here in person. It's been quite some time since we've been able to gather with this many people here at the Board of Health in person. Would like to congratulate you, Mr. Chair, on your election to chair, and to you, Madam Vice Chair, on your election to the position of Vice Chair. My welcome to all of you who are new and returning members. We are certainly looking forward to working with you, and in fact, a number of the senior team at Toronto Public Health are here today as a show of our interest in working with you for the term ahead. I do want to offer special thanks. We do have some citizen members who are on the line and attending their last Board of Health meeting. Thank them for being here once again today. The turnover for that particular group happens when new members are appointed, and we expect that that will happen in time for the February 21st meeting of the Board of Health. At that point in time, when we have the full complement of the new board members for the next year in front of us, we will be providing the members of the board with a full orientation presentation at that point in time. But for today, as you see on the screen in front of you, I am pleased to present, on behalf of the team at Toronto Public Health, a brief slide deck to update the members of the board on the current respiratory viruses season that we're experiencing here in the City of Toronto. So on to the next slide. You've probably heard through many media sources, and hopefully you're keeping up with our information sources on our dashboard as to what is happening here in the city in and around respiratory viruses. And we know that at this point, there are 3 primary respiratory viruses that continue to circulate: RSV, or respiratory syncytial virus, influenza, and COVID-19. But relative to where activity was in the late fall, the last time we were in front of the board, I can tell you that now you can see here on this slide that influenza activity peaked in December and is now declining. We are seeing COVID-19 activity slowly increasing, but thankfully severe outcomes remain low, and RSV activity is at seasonal levels. As we turn to the next slide, we're going to depict some of this information for you in a more visual format, and you can now see that on the screen in front of you now. Here what you have are graphs showing the total number of reported COVID-19 and influenza cases each week from the month of September through to the first week of January. And looking at data this way helps us to understand the number of cases we're seeing in respect of these 2 diseases, and as well to observe some of the trends. Briefly, what these graphs are showing you is that in recent weeks, COVID case activity has steadily increased, while flu case activity has significantly decreased. And we can see more by way of influenza on the next slide. So looking at this slide, the next slide we have in front of you, this gives us a sense as to what this year's influenza season looks like thus far in comparison to previous flu seasons. And on this particular graph, what is shown is the cumulative number of reported influenza cases in the current season to date compared to the 5-year average of cumulative reported influenza cases. Putting the graph into words, what you're seeing here is that the current influenza season started earlier and peaked earlier relative to previous years. So again, this was something that we had alerted to the board was likely to happen given the experiences of the Southern Hemisphere, and in fact, that is what has come to pass here in our jurisdiction. Turning to the next slide and looking specifically at local COVID-19 activity, I'll remind members of the board that the best source of information is our TPH dashboard, which provides data on a number of indicators, everything from case activity and case counts and rates to wastewater data and outbreak data. So what you see here on the slide in front of you now is a screenshot of our most current dashboard update. And as you can see, COVID-19 case and outbreak indicators are on the rise, while wastewater surveillance trends are decreasing, as you see at last check, and that's at the bottom part of the slide there. So we will continue to monitor, of course, to see how this continues. And in particular, we're interested in seeing whether such things as wastewater surveillance and the decrease that we're seeing there right now is reflected in clinical data and in our clinical circumstances. Turning to the next slide, you see a continuation of that which is presented on our COVID-19 dashboard, this time focused on severity indicators. And as I've mentioned earlier already in the presentation, thankfully, we've seen here that hospitalization and ICU admissions in the city remain low. On to the next slide, we're now turning to a bigger picture look at what is happening with COVID-19 subvariants. And as you've likely seen through the news, there is, of course, continued evolution of COVID-19 Omicron subvariants, with emerging subvariants being reported seemingly on a regular basis. I was going to say daily, it might not quite be that frequent, but certainly seen on a regular basis, reported through the media. You've likely heard about the jumble of letters and numbers that are these new Omicron subvariants, BQ.1.1, XBB.1.5. These are some of the subvariants that we're watching very, very carefully. As you can see, locally, BQ.1.1 represents a little over a quarter of sequence samples here, based on the most current data we have. But what you've likely been hearing about in the media as of late is XBB.1.5. Interestingly, the most transmissible Omicron subvariant seen thus far, and this one in particular is spreading rapidly in parts of the United States, notably the northeast of the United States and in Europe, but at this point, levels in Ontario remain low. Further to the information in respect of XBB infection, or XBB as a subvariant, it's our current understanding that there isn't necessarily higher rates of serious illness associated with XBB infection. That's not been found to date. And we have also noted that the best advice at this point in time and the best information we have at this point suggests that continued use of existing layers of protection are still very important and continue to reduce the risk of severe outcomes associated with these new COVID-19 subvariant infections. Turning to the last section of today's presentation on respiratory viruses, I will speak a little bit about our vaccination efforts to date. As members of the board will no doubt be familiar with, vaccination is an important part. It continues to be a key part of protecting public health. Keeping up with COVID-19 vaccination and boosters, along with routine immunization in general, these are some of the many things that we can do together to best protect our community against infections and to protect our ability to continue to function well. Turning to the next slide, this is an update to the board to tell you about what has been happening since the last time we gathered late last year around our COVID-19 vaccination strategy. And you won't be surprised to hear that our multi-pronged strategy continues to be implemented and will continue for some time yet to come. We are offering COVID-19 vaccine along with many other vaccination partners through a broad range of channels, whether we're talking about pop-up and mobile or fixed immunization sites, pharmacies, primary care. There are many channels by which people can access COVID-19 vaccine. Our efforts, of course, are focused on ensuring that those who are at greatest risk of severe outcomes from COVID-19 are up to date. So we have noticed over the fall that most people came out to get the new COVID bivalent vaccine in conjunction with their flu shot. I should let the board know, and some of you are likely familiar with this already, that this was the time when we as Toronto Public Health went into long-term care to offer residents the new vaccine, and when in fact long-term care partners were directly offering the vaccine to their residents themselves. So it was something, again, very focused on those who are at highest risk of serious outcomes or severe outcomes associated with COVID-19 infection. So with that focus on the older population, you'll see on the next slide what the vaccination uptake looked like. And in fact, on our next graph, we show the total number of COVID-19 vaccine doses administered in Toronto by immunization week and by dose since September 2022. And as you'll see, that you can see reflected in the graph that at this point in the pandemic, our focus is indeed on those at greatest risk for severe outcomes for COVID-19. I talked a little bit about our long-term care strategy. We also focused on naturally occurring retirement homes. And as you can see here, with that combination of focus on naturally occurring retirement communities, I should say not homes, naturally occurring retirement communities, and as well long-term carers and the older population in the city, those at highest risk for severe outcomes associated with COVID-19. What we saw over the course of the fall was that the majority of the doses were in fact 4th and 5th doses. And that is depicted there for you on that graph. Coming to the end of the presentation, wanted to inform the board that in keeping with our interest in ensuring that you and the public are aware of that which we are doing and what our progress is like to date, we are in the process of updating our vaccine dashboard. Really, the idea is to make sure that we're capturing the most relevant information in respect of the campaign and making sure that the dashboard is user-friendly. So this update should be happening to our vaccine dashboard, not this week, but next week. So I'll ask you to stay tuned and look out for that as a tool to help keep you informed in respect of our vaccination activities and our COVID-19 immunization activities in particular. So with that, last slide of the presentation, which doesn't have a lot of words on it, but carries a lot of meaning, I know, for all of us at Toronto Public Health, for the members of this board, and I would dare say for the citizens of this city. We are almost at 3 years since the first case of COVID-19 was identified in this city. We will mark that 3-year anniversary on January 25th of this year. As well, in 2023, we mark another milestone, as it has been 20 years since the first SARS outbreak occurred in this city. So one can't help, as we think about that, but to reflect on, where we've been, and perhaps to use that to think about where we're going. And as I think back on these milestones, what stands out for me are the incredible efforts and the many, many sacrifices that Toronto Public Health staff and many others have made, whether we're talking about the last 3 years or in response to the outbreak of 20 years ago. And I also am struck by the many accomplishments that were achieved as a result of those efforts. Whether we're talking about world-leading rates of vaccination against COVID-19, whether we're talking about the reduction in what might have been greater numbers of severe outcomes, and when we're talking about 20 years ago, ultimately those efforts did result in the end of that SARS outbreak back in 2003. That's not to say that we did things perfectly, right? We did not. As always, when we reflect back, we know that there were and there are opportunities for improvement. So while we are not and were not perfect, I can assure the board that certainly in the last years, the entire team at Toronto Public Health has acted with skill, with passion, and always with the health and well-being of the people of Toronto at the center of everything we do. I'm grateful beyond words to the team at Toronto Public Health and to all those who have contributed to our efforts these last 3 years. And by efforts, I mean COVID or non-COVID efforts, and I mean those who contributed directly and those who contributed indirectly. I am beyond proud of all that the Toronto Public Health team has done, and I sincerely hope that you are too. As we turn our attention to this new term of the Board of Health and expand our focus on new and pressing priorities and resume functions that were paused during the COVID-19 pandemic, I do want to stress for the board the toll and impact that this experience has had on our team at Toronto Public Health. So while the health and well-being of Toronto residents is at the center of all that we do, the health and well-being of our staff is also at the top of my mind and must remain a critical consideration as we chart together our work for the months and the years ahead, so that we can serve the people of Toronto and meet their needs in a manner that continues to make all of us proud. So with that, Mr. Chair, I thank you and I thank the members of the board for their attention, and I will turn it back to you.
Thank you, Dr. Villa. Okay, that's working. Before we proceed, I do have a motion I'd like to put up on the screen. First, thank you. It's just to extend the registered speakers to 10:30 a.m. and also to limit speaking to 3 minutes. So we have a number of speakers here today, and I think it's just yeah. So I'm going to move that. All those in favor of that? Oh, you want to speak to it? Go ahead. Sorry.
I understand that there are a great many people who want to speak to us and that we have a lot of time pressures, but I think that the issues that we're going to be dealing with are of critical public importance and people should be given their full 5 minutes. So I'm going to be voting no.
Any other speakers? Okay, all those in favor? Opposed?
Thank you, Mr. Chair. This is a recorded vote on the motion moved by the chair to end the registration of the speakers list at 10:30 and limit speakers to 3 minutes. All those in favor?
Just a moment. I'm fine with the ending the registration. It's just the 3 minutes part. So if we could just vote on that part separately.
One at a time?
Sure. Yeah, we can split the motion. Sure.
Thank you for that clarification. So just to clarify, the recorded vote is strictly on recommendation 2, that the speaker's time be limited to 3 minutes. All those in favor, please raise your hand. Councillor Thompson, Councillor Mantis, Councillor Moyes, Director Bowery, Director Johnson, Director Mulligan. Anyone opposed? All those opposed? Councillor Perks and Councillor Malik. The motion carries. Oh, I'm sorry, Councillor Bravo. My apologies, Councillor Bravo. May I have your vote, please? Opposed. Thank you. I'm sorry. That motion carries.
Okay. All right, thank you. Didn't think that would have been controversial. We're now going to hear from the registered public speaker, and then oh, sorry. Well, we need to do the deputies first. Okay. So the first deputant is Derek Morgan. Welcome to the Board of Health. You have 3 minutes to speak. When you're getting close to the end of the time, I will let you know.
I just want to say, by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied in doing so as fraud. God bless His Majesty the King, and long live His Majesty the King. Let the record show that I do not consent to the warrantless searches taking place downstairs here at Toronto City Hall. I just want to say good for you to Councillor Perks there for trying to make sure that everyone had their 5 minutes. Sorry to put any of you out. So because of all these viruses going around, there's so many people still arguing on Twitter about debating about mask wearing. So I just want to refresh everyone's memory about what was originally said about mask wearing. I think it was the first day or the day after we had our first COVID case here in Toronto. And this was asked of Dr. David Williams. And what he had to say was, our protocols with respiratory conditions throughout the season, we have never recommended the wearing of masks in public. One of the problems with wearing the mask is, as both Dr. Davila and Dr. Yaffe alluded to, is I see people wearing the mask and then they're handling stuff. And then they put their hand on their mask and they touch their mouth and do everything like that. It may give that person some solace, but if you're going to do that kind of respiratory protection, it's more important that you don't put your hands up to your face and mask. And the mask may not be cleaned on a regular basis. So you actually may be recirculating stuff. And remember, the stuff at the time we were told was a deadly virus named COVID, right? So there's a lot of things about the handling of that, the same as you do in the hospital. You're very strict about how people wear them and change them and handle them, how they put them on and take them off. So it's not just a clothing thing to do, because it's just to be used for very specific purposes in a specific timeline and disposed of and handled accordingly so. So I understand that some groups like to do that if they want. That's their prerogative, but he mentions it a second time. We have never recommended that in Ontario. And then the TTC went on to post something on Twitter, on their media account, and they had to say that the TTC takes the health and safety of its employees and customers very seriously and is in daily communication with Toronto Public Health. Toronto Public Health continues to advise against wearing masks for healthy individuals and has noted that masks may in fact increase risk, as they can lead to individuals touching their face more often than necessary. And I just wanted to point it out that Dr. Davila was talking about the importance of vaccination. How many people remember that Justin Trudeau went on something called the Brandon Gomez Show, and he pointed out that we're not a country that makes vaccination mandatory, and Brandon Gomez even added that, breaking news, PM Trudeau says Canada will not mandate vaccinations. Like, there's no list, there's no speakers list here. I don't even know how many people were signed up, why we're getting reduced 2 minutes. You thank me for saying that? Okay.
Director Thompson, Councilor Thompson.
Okay. Mr. Chair, thank you. But Councillor Thompson, yes. Through you to Dr. Davila, I know the federal government is talk about at present there is a level 2 travel health notice and concerns. I'm just wondering, when we look at the workplace, is there a level of concerns that we should have as well for the workplace?
So through the chair, Councillor, thank you for the question. I think that if we're talking about COVID-19 in particular, I just want to make sure that I understand what the concern is. I think the message that we've been providing is that there are certain circumstances that are higher risk and certain situations that are higher risk and certain actions that we can take to reduce our risk. So certainly being within indoor crowded settings where ventilation is less than ideal is a situation where if there is somebody with a COVID-19 infection, that your risk of transmission is actually higher. The kinds of things that we can do to reduce our risk are going to be things like making sure that you've got the fall booster vaccine on board, that you're wearing a mask, especially in those crowded and indoor settings where there are lots of people and where ventilation is less than ideal, washing your hands, staying home when you're sick. But just a reminder to members of the Board of Health, that which happens within the context of workplaces is actually a matter of occupational health and safety. So while we certainly interface with occupational health practitioners, it is a slightly different area of practice. But again, the principles that I've just articulated would apply.
Thank you. And then what message would you have for students and the school community as such, particularly as it relates to the public school setting and so on, where children are, obviously, there's a tendency for them to get all manner of things, as we know, just in terms of the nature of things and so on. But as it relates to COVID and the challenges that we've had, closures of schools, school children not going to school, what's the message that you would actually want to communicate to them so that there's a full understanding, so both for the educators, the parents, and community at large?
Yeah, so through the chair, again, Councillor, the same principles apply here, but let's talk a little bit about schools. There's no question that children benefit from being in person in schools. We've seen that that has been one of the many challenges experienced over the last couple of years. That being said, the circumstances within the school and the measures that are taken within the school are under the purview of the Ministry of Education. However, COVID-19 advice and the methods and the tools that we can use in order to mitigate risk for ourselves and those around us are exactly as I've explained. Use of an uptake of vaccine, making sure that you're up to date with your vaccines and that you've got the latest booster available to you in accordance with the timing that that's supposed to happen. Wearing masks, especially in those crowded and indoor settings, staying home when you're sick, washing your hands. These are the layers of protection that you will have heard us speak to many, many times, and they continue to be the best tools that we have at our disposal.
Thank you. Thank you, Mr. Chair.
Thank you very much for the presentation. And in the presentation, it states that the influenza season started earlier and peaked earlier than previous years. Do you have a sense of what accounted for that?
So through the chair, I don't know that I can actually really describe or explain that entirely. We know that that was certainly what was witnessed in the Southern Hemisphere, which experienced its flu season earlier than we did, again, just given the timing and the way things work. But I don't know that we fully understand everything about viruses, to be quite honest. I would tell you this, that the experience of the last 3 years with COVID-19 has certainly reminded us within the public health sector, and I would say largely within the medical profession, of the need for ongoing humility as we seek to understand that which is happening. But I don't know that we have fulsome explanations for all of these interesting phenomena.
So to that point, I guess we'll look at this closely. I mean, knowing that started earlier, peaked earlier, how would that change our response in the future?
So through the chair, I think what we do, and we do this every year, is we do observe that which happens in the Southern Hemisphere to give us some sense as to what we might anticipate as we approach our own flu season. The scientific endeavor and seeking to understand, more and more about infectious diseases, including some viruses which have been around for a very long time, continues. And I expect that you will see us engage in those conversations and bring new knowledge to the board as it becomes known to us, and certainly deploy new knowledge in our efforts to protect the health and well-being of our citizens.
Okay, thank you. Any directors online? Director Mulligan, go ahead.
Thank you, Mr. Chair, and congratulations on your Dr. Davila, you mentioned the layers of protection in one of your responses, but you didn't mention them in your presentation. And so I'm just wondering, it really does seem from the bulk of the presentations that we've received over the last 3 years that Toronto Public Health has focused almost entirely on vaccination and much less so on masking and on ventilation. So I'm just wondering if you could speak to why that is and how that decision was taken.
So through the chair, thank you, Director Mulligan, for the question. I'm not sure that I would characterize the balance of information that we've presented in that way. Certainly, we have tried to speak to all the layers of protection as best we can, and vaccination happens to be one that is more directly within our purview and for which we have greater control. That being said, certainly messaging around masking and ventilation and ensuring that risk can be brought to bear by being in more outdoor spaces, being in places that are better ventilated, has been part and parcel of our messaging, and will continue to be for the foreseeable future. As I mentioned in my earlier answer to Councillor Malik, of course, we're constantly watching that which is happening in terms of the science, whether it's related to COVID-19 or other infectious diseases, and we will adjust our practice and our messaging in accordance with the best available evidence that's out there.
Thanks, Dr. Davila. Just on the same note, it was March 12th of 2022 when Councillor Cressy and I put forward a motion about ventilation and asking the city to look into the property standards, the tower renewal program, to ensure that healthy air quality is part of the public health revolution of learning from COVID-19. Could you, and then on November 8th, the board asked you to urgently explore all possible avenues with respect to masking, whether that was necessary to help with the pediatric health crisis in healthcare. So I was just wondering if you could give us an update about both the ventilation and the masking measures since the board made those two requests.
So through the chair, thank you again, Director Mulligan, for the question. There was a little bit of, I guess, static on the as you were asking your question. But what I can tell you is that the issue of ventilation is one that is actively being discussed. I certainly have raised this with our colleagues at Public Health Ontario and can tell you that there is a lot of work happening on this front. I don't know that all the answers are quite there in the way that we might like them to be, but certainly there is work that is happening to support scientific knowledge and dissemination of what we know in respect of best practices related to ventilation. As I recall, there is a group, and my colleagues may be able to help me, the ventilation expert group in the United States, the acronym for them is ASHRAE. They are actually looking at these standards right now and undertaking studies in respect of ventilation and offering some advice, some much needed advice, I think, to the community and to practitioners, people who are in charge of heating and ventilation and air conditioning systems, based on the best available knowledge. So certainly we're looking forward to that. And in respect of any communications that we're doing on masks, again, we are constantly watching that which is being published in the scientific literature and that which is happening in other jurisdictions to help inform our actions here locally. as we're interested in making sure that we're using the best available knowledge to help protect the health of Torontonians.
Thank you.
Thank you. Any other directors online? Okay, seeing none, we'll go to, any directors want to speak to the item? Okay, seeing none, we'll go to the vote. All those in favor?
Mr. Chair, I would like to speak.
Oh, sorry, I didn't see you there. Go ahead, Director Mulligan. My apologies.
I would just, thank you. Yes, no, I would like to move a motion, and I didn't prepare it in advance. I'm sorry, but I want to move that we request that the medical officer of health report to the next board meeting with updates with respect to the ventilation motion of March 12th and the Massey motion of November 8th, please.
Okay, we'll need to hold that down so that staff can prepare the motion. Okay.
Okay, can I speak to it at this time, or should I wait?
I'm being advised that you should wait.
Okay.
So we'll hold that down. So our next item is HL 1.4, update on 2023 Toronto Public Health Operating Budget Submission and Service Levels. May I have a mover to put that on the floor? We don't need a mover for that?
You don't need to do that.
Okay. So we'll begin the presentation.
Mr. Chair, though, on a point of order, I will need to go in camera for a portion of this.
Okay.
Yeah.
Thanks for letting me know.
So thank you, Mr. Chair. You'll note that my colleague Althea Hutchinson is over at the speaker's desk there and will be taking us through this presentation.
So good morning to the members of the Board of Health. I will be taking us through a presentation. The title is there. Basically, the presentation is being presented today. It's a follow-up from a recommendation that was made to the Medical Officer of Health at the November 8th board meeting. In particular, the recommendation was to provide an orientation update to the Board of Health on our 2023 budget submission and the process at its earliest possible board meeting in 2023, including an update on Appendix A, which was an appendix that was attached to the report that was presented on November the 8th regarding our 2023 service levels, as well as providing some additional information regarding the proposed 2023 budget, as well as providing additional information on the planned resumption of regular services. So next slide, please. Before I get into the finer details of responding back, I did want to provide a bit of an orientation to the Board of Health. There is, of course, as Dr. Davila indicated, going to be a much more fulsome orientation that's provided to the board, but I wanted to focus in particular around public health funding and some of the aspects that touch on public health funding, in particular the funding for Toronto Public Health. So you'll see that the first thing that I wanted to touch on is the Health Protection and Promotion Act. And this is a piece of legislation that basically outlines for public health sectors and public health units some of our, I'd say, our raison d'etre when it comes to the Ministry of Health. And included in that, it's particularly important because there are quite a few items within that little piece of legislation that does speak to the budget and a significant portion of our budget for Toronto Public Health. And what it also does is the legislation also outlines the responsibilities of public health units in regards to the role that they play. But it's not the only piece of legislation. I do want to note that there are other pieces of legislation that guide the work that we do and as well as guide how our funding is being used. In particular, there's one section within the HPPA that I would like to note for the board, and it's that the minister, it's section number 76, and it's a direct quote. It says the minister may make grants for the purposes of this act as on such conditions as he or she considers appropriate. And the reason why I outline that is because the next item I want to touch on is the Ontario Public Health Standards. So the Ontario Public Health Standards is, I would say, it's sort of our playbook in terms of all the programs that are expected to be delivered by Toronto Public Health. The standard includes also guides as well as protocols that provide additional information and details in terms of what our responsibilities are and what our obligations are with the ministry. And included in that, there are also what I would call performance measures, which is one of the reasons why we're here today, is to come back to the Board of Health, talk about service levels. Service levels, of course, are a type of performance measure. The Ontario, those are not the only two pieces of, I would say, either legislation or contracts that we have. In addition to those two pieces, the legislation as well as the Ontario Public Health Standards, we also have a contractual agreement between the Board of Health and the Ministry of Health, and it's called the Public Health Funding and Accountability Agreement. This agreement is like many other contracts where it lays out, it's very static in terms of a contract. It has its obligations. Included in there, there are particular schedules that we do have, and one of those schedules that is of real importance to us is actually the funding schedule. And in that funding schedule, it lays out what the dollar amounts are, any particular special programs that the ministry expects us to do, as well as additional instructions to public health units in terms of their obligations to the ministry. And to make matters even more complicated, those are not the only ones. We also have other contracts, and we have other contracts with, we do have other contractual obligations with other parts of the Ministry of Health outside of the Chief Medical Officer of Health. We also have contracts with other ministries, like the Ministry of Children, Community and Social Services. And then on top of that, sometimes we also enter into all the contracts with other orders of government, such as the Public Health Agency of Canada. And the last funder that I will note, of course, is the City of Toronto tax base. So the City of Toronto does provide funding to Toronto Public Health and through the tax base, through its tax base. And the one thing I want to move, before moving to the next slide, I just want to note one thing of particular interest. When it comes to the Ontario Public Health Standards, and it comes to the Ministry of Health, when it comes to the Chief Medical Officer of Health and the funding that we receive from that part of the ministry, the majority of it is a cost-sharing program, where 70% is provided by the ministry and 30% is provided by the city. What's interesting about that is that even though it is a 70-30% funding agreement, the way the agreement actually works is that the expectation is the city provides its 30 cents first before the province provides its 70 cents. So without the city contributing into public health, in Toronto Public Health, we're not able to secure the funding from the province. And even though I do say that it's 30% for the city and 70% from the province, I want to note that there is a cap. The province does cap our budget. So even though the city might be willing to contribute more towards funding our budget, the province does cap the amount that they will fund. And at this point in time, the cap is roughly $133 million. Next slide, please. Thank you. Next slide. Oh, thank you, that slide. So as I indicated, we do get funding from the City of Toronto. We do get it, as I said, for the cost sharing, but I do want to note two things within the City of Toronto Act, which I think is quite unique for Toronto Public Health, which some other public health units do not have. And that is that when you look at the HPPA, it actually says that boards of health can determine what their budgets are, and then what they do is, for the lack of a better way, they send a bill to what the ministry calls obligated municipalities. And that bill goes to them. There's an expectation that those municipalities will pay that bill. So the Board of Health determines its budget, sends the bill on, and they get their funding that way. But in the City of Toronto Act, it does put a limitation on Toronto Public Health, which I want to note particularly for, we've never had an opportunity for those who for those from the previous term and for some of our new members. And I'm going to read it directly from the City of Toronto Act. It's a section that talks about funding. It says, despite the HPPA, the city has the following function with respect to the board. The duty of providing the board, the city employees, including public health nurses, that the city considers necessary to carry out the board's functions, including its duties in respect to the mandatory health programs and services. And the reason why I point that out is because I just wanted to note that it is this Toronto Public Health is quite unique when it comes to, in comparison to other public health units, in that the board itself doesn't have employees, we're employees of the city, and that the city does hold a bit of a greater power in terms of the budget for the city. In terms of the actual budget process itself, for those of you who are council members, you have last week, we kicked off the budget process, an exciting time for those of us in the finance world, maybe not so much for you, but certainly an exciting time for us. And I just want to note that, you know, the way the budget process works is really not necessarily challenging, but, you know, we do have a Board of Health Budget Committee that does exist. The expectations from us is that we always want to come to the Board of Health Budget Committee to have discussions about the budget that's brought forward from the Board of Health to the city's budgeting process. The ideal timeline, however, as I think for those of you who were either at the City of Toronto Budget Committee, Stephen Conforti, I think, or noted that our process actually starts, the city's process starts very early. It starts usually in June, July. And so it is always my desire to get in front of the Board of Health Budget Committee. We have not been able to do that in a fulsome way throughout COVID, but I'm hoping with, you know, 2023, we'll be able to go back to some of our normal processes where we will come to the Board of Health Budget Committee. Presentations will be made, discussions will happen, then it will move on to the Board of Health Budget, the Board of Health Committee proper for a recommendation, so we're able to meet the city's timelines, which is typically around September, is when they kind of really finalize the budget going into the city process. When it goes into the city's budget process, for those of you who are, you know, new councillors, there's a lot of back and forth that actually does happen. And most of those tend to be administrative things that are happening. They're not necessarily substantive. If they are substantive in nature, however, we feel it's an obligation to come back to the board and explain those items to the board. So that covers sort of how the operating budget works. So there's an operating budget. There's also a capital budget and plan. So it's a 1-year capital budget, a 10-year plan. And finally, there's this concept of service levels. And that's one of the reasons why I'm back today is to have a deeper discussion about what our service levels are, particularly as they've been suspended throughout the course of COVID, as we've spent a lot of time and care and attention towards our COVID-19 response. So next slide, please. But before I talk about the City of Toronto service levels, I actually want to draw your attention that service levels or performance indicators under the Ontario Public Health Standards, they're within this family of just performance measures. And performance measures are kind of typically looking at a few things. You know, what do you do? When are you doing them? And more importantly, how well are you doing it? And what outcome? Are you achieving whatever goal or outcome or mandate that you've been asked to do? So outside of the service levels that the City of Toronto has, through the Ontario, the HPPA and the OPHS, as well as our contract that we have with the ministry, we do have an obligation in terms of performance indicators. And that goal that's written out on the slide is basically the goal that has been communicated to us through the Ministry of Health in terms of why are they interested in performance indicators. And in particular, they want to understand how the work we're doing, the funding that's being provided is contributing to population health outcomes. There are 2 types of indicators that we have. We have local determined indicators, which are the indicators that a public health unit would actually put forward. And we also have ministry specified indicators. The ministry specified indicators are provided for you in Appendix A of this presentation. In terms of the locally determined indicators, these are new. They came in, I say that, but then I think back, it's actually not that new. It's 2018 is when they came into place. But however, we haven't had an opportunity other than once to report back fully on our locally determined indicators because of, you know, the event in the room, COVID-19. That being said, the ministry has indicated that they would like us to come back, and we are busily working on gathering those local determined indicators to report back to the ministry in terms of how we're doing with the indicators that we did provide to them in 2018. Next page, please. So the City of Toronto, very much like the OPHS, have performance measures, but they call them service levels. And the service levels, these bullets here are pulled directly from the service level report from last year that the city provided. So it indicates what the city is trying to communicate is they're trying to communicate, what is the agreement between staff, council, and the public? And ideally, these service levels, so they should be, what is being achieved and how often is it being achieved? But service levels are difficult, just as performance indicators are difficult when it comes to public health. And then one of the reasons why is because they act more as a proxy to capture the real value of public health. For those of you who are at some point along the way, I will be back making a presentation where I will touch on the value of public health. And one of the things that we sometimes talk about as a hallmark is tobacco and the work that Toronto Public Health and other public health units did in terms of tobacco cessation. So there is no perfect service level that speaks to that because it really is looking at bringing forward policy changes that end up with, I would say, not behavior modification, but modifying the behaviors of individuals so that they adapt, healthier lifestyles. And by doing that, we're able to achieve, longevity in life. That is a very difficult thing to capture within a service level. So, and that's why I say that sometimes service levels, we're counting what we do and how we do it and how often we do it, but it doesn't necessarily speak to the true goal of what public health is trying to achieve or the value of public health. It also, they don't capture all the activities that we do. And one of the reasons why is just, as I said a little while ago, when you're writing a policy document or you're trying to change the environment to which individuals are living, it is very difficult to tack and say that we're going to be doing this one. Another one I also like to always sometimes go to is something called animal bites. So we do have a service level that's called animal bites. And what it doesn't really act, even though we don't actively report it out, it's a proactive measure that we report on. Because if the goal is we never want to have animal bites, we don't want to put it in our service levels, we're hoping that there are 1,000 animal bites. No, our goal is that there's none, but what we can do is say that we react to every animal bite and then we'll report on how many we reacted to. So what that says is that, sometimes those service levels, they actually don't really reflect the level of effort or the resources that are required in order to achieve them. A great example was the charts that Dr. Davila just put up in terms of respiratory season. Those charts, as simple as they may be, they take a lot of effort, they take a lot of resources in order for us to effectively communicate to yourselves and the public about where we are in terms of the pandemic, where we are in terms of respiratory illnesses. So, next slide, please. So I'm going to speak very specifically now and I'm going to give you a high-level view. There's more detail in the appendix that accompanied the report. But basically, even though Toronto Public Health has, quite a number of services, we report our service levels out on 6 programs with 61 defined service levels. The 6 programs are listed there: chronic disease injury prevention, emergency preparedness, environmental health, family health, infectious diseases, and public health foundations. And on the right-hand side, I list how many service levels there are for each of those programs. In the 61 programs, 51 of them, at the very beginning of a budget year, will indicate what we think our service level is going to be or what our targets are. Some of the service levels are counts. Some of them are actually, we intend to, cover, we intend to do something at 100%. So no matter when the incident presents itself, our intention is to respond. But we also have 10 service levels, we retroactively report those ones. And the reason why they're retroactively reported is like animal bites, which I just explained. It's very difficult to write down that we're expecting, 1,000 animal bites. It doesn't really, we could say our service level is 100% response, but instead we prefer to retroactively report, on how many have actually occurred. So then, and we use that information to, in order for us to figure out, the resources that are needed. As I was thinking about presenting, information around service levels, it occurred to me, and I'm going to go a little bit off script here, so this is brand new even for Dr. Davila, it occurred to me that when you're there, and when we're there putting together a budget, and I've seen this happen because I've been with Toronto Public Health now for 5 years, our goal is to, going in, our goal is to meet every single level of service, to respond to, every single animal bite, to respond to every infectious disease. That is our goal. But things happen that, sometimes you have to make decisions about what is priority. And sometimes that's what happens when you're living through a fiscal year. The thing I've noticed the most about being in public health is that as much as it's predictive, it's unpredictable. And it's that unpredictability that we need the latitude for in terms of being able to respond. And so that's why we're not able, I think, at times to capture every nuance of everything that we do, because we do need to have that flexibility within our budget, within our resources, in order to respond to the unexpected. The last thing I would say about this slide before I move on is that service levels themselves, the ones that we do have, they have been around for a very long time. They've been around, some of them, for well over 10 years. And in going back and looking at these service levels, because we have not, to be quite, transparent to this group, we have been so consumed with COVID for the last 3 years that some of the activities we might have undertaken on an annual basis to review and refresh, they might not have happened as timely as we would have liked. Going back and taking a look at our service levels did highlight to us that we are living with things that might have been 10 years old that made sense. We certainly have service levels that predated the OPHS performance indicators and definitely predated COVID-19. So moving on from that, though, I do want to talk about what it is that we are doing and where are we in our 61 service levels. So if you could go to the next slide. So in terms of the 51 that we are proactively reporting on, that's the status of them. 26 of them, they are fully recovered. All those programs are up and running. And the details of that, of course, are in the attachment with the report. 19 are partially recovered. And when I say partially recovered, that means that we're on our way to full recovery. We're bringing back those programs, and we have set ourselves a certain percentage or we're partially anticipating recovery, moving on to full recovery, either within 2023 or 2024. We do unfortunately have programs that continue to be suspended, particularly in our CDIP programs, chronic disease and injury prevention, as the staff continue to be redeployed to the COVID-19 response and our vaccination campaigns. We have 7 that, from the time that we came to the Board of Health in November to this time, because as I indicated, our landscape is constantly changing. We have 7 where we have active plans underway for full recovery in 2023. And finally, we have 1 that is operating, but maybe not as we originally conceived, because there is still a very strong focus on COVID-19, and that's one of our surveillance, measures. Excuse me, if you could go to the next slide, please. And finally, in terms of the 10 programs that we retroactive report on, 9 of them are fully recovered. They have been for they've either been operating for the entire amount of COVID, or we recovered them in 2022, and they will be fully recovered in 2023. And another one we have, again, which is a surveillance one, that is really focused on, it's still operating, but there's a strong emphasis on COVID-19, as COVID-19 continues to be one of our priority areas moving forward into the next year. So that takes me to the end of my presentation. Of course, as I indicated, there's an Appendix A in case you are interested in additional information in terms of the ministry's specified performance indicators. So thank you.
Thank you so much, Ms. Hutchinson. Much appreciated. We do have one speaker on this item, Stacy Naige. Are you available? Either online or in person? Okay. Okay. Right, we don't see anyone online in the waiting room or elsewhere. Okay, so we'll move on then. To the directors, any questions of staff? Councillor Perks, go ahead.
Thank you, Mr. Chair. And I'm not sure how you want to handle, do you want to do the in-camera questions prior to the public questions? How do you want to do that?
Let's do the public questions first, and then we can go in camera, if that's okay with you?
And then in-camera, and then motions after the in-camera questions?
Yes.
Okay. So, thank you for, oh, she vanished. Where'd you go?
Mitch Hutchinson,
Thank you for that. That was very, very helpful. I guess my first question is, my understanding of the Health Promotion and Protection Act, and you touched on this a bit, is that local boards of health can add additional services beyond what's in the ministry requirements, provided that they support them and they've gone to the local council and got the local council to support them and also fund them. Is that roughly correct?
So through the chair, that is roughly correct. It does not, however, guarantee provincial funding for that activity, whatever it is.
So in that event, we would ask the municipality for 100% funding?
Yes, that is correct.
Even if we go, and that also addresses the issue of the cap that the province puts in?
That's correct. So what happens is that in order for provincial dollars to come forward, as Ms. Hutchinson said, the city needs to put forward its share of the money in order that the province will then meet their share of the funding. And it is within their purview. Sometimes they agree, and sometimes they choose not to take up the opportunity.
Right. And in November, when we got the initial service level report, there were a number of things that weren't fully explained, and in this one you explained them more fully. A common theme seems to be that because of COVID, we had to reassign staff, or the world outside in schools changed, and we have yet to reinstate those programs fully. Is that a fair comment?
So through the chair, that is a fair comment, but as you'll notice from Ms. Hutchinson's presentation, the vast majority of our service levels are either fully recovered and or on their way to being there.
Well, I understand the majority of them, but there are quite a number of programs relating to education work that Toronto Public Health would do in the schools around health promotion and prevention, some work with seniors, some work around working on food security and food education, where the service is, according to the presentation I just saw, either not returning right now or returning gradually, but there's no date defined. Is that a fair summary of what I've seen there?
So through the chair, yes, although I would add, Councillor, that some of the areas are actually, so for example, within the realm of schools, we are actually quite active with schools, albeit with a largely COVID focus and COVID sort of follow-up focus, but still very much engaged with our school partners on overall health of students and school communities writ large, just as one example.
I'm not making any suggestion that we're not, but there were particular services and service levels that prior to the pandemic, this board, funded, and city council funded it, and we would get annual reports on the service levels. But this year, what we're getting is more in the line of, because of COVID, we suspended this. Eventually, we're going to bring it back. We can't give you a specific date right now. Is that a fair summary?
Through the chair, for a few measures.
Yes.
For a few measures.
Oh, I'm not saying by the majority of them.
That's true.
What would we have to do as a Board of Health if there were specific services and service levels in that chart that we felt we should ask the city to fund this year?
So through the chair, there are a couple of things that I would advise the Board of Health. First and foremost, I would suggest that, we are actively looking at that which is most important from a public health point of view and from a public health expertise point of view in order to advance, protect, and promote the health of Torontonians. The last 3 years have changed many things very significantly, and I think we have an opportunity here at the Board of Health to reflect on all the lessons learned and to come forward with service levels and with proposals that actually meet the need of Torontonians now. As you heard from Ms. Hutchinson, some of these service levels have been set years ago and in fact don't even reflect performance indicators as articulated by the Ontario Public Health Standards, much less reflect that which is most important to the health of Torontonians now. So we do have some reports that we're planning to come forward to the board with in the weeks and months to come, some sooner than others, for the board to consider so that we can think about, knowing what we know now, having been through the most significant public health disruption in the last 100 years, what matters most now, and where should we be focusing our efforts if we're really serious about promoting and protecting the health and well-being of Torontonians.
I appreciate that, but, and Mr. Chair, you forgot to start my clock, so I'm just...
I have no idea what time we're on now.
I only noticed now, I swear. I swear. But to be clear, you know, in answer to my first question, this board may, if it believes that there is a health issue in the city of Toronto, direct you to provide resources to it, provided we can persuade City Council to fund it.
So through the chair, yes, all budgetary matters must go through council.
Yeah.
And then, you know,
The critical piece is
that
that the Section 9 of the Health Protection and Promotion Act gives this board discretion to add services.
That is correct through the chair. Again, it all depends, but the ability to provide said services depends on funding, which has to be approved through a city council and for which the province may or may not choose to participate.
So in conclusion, final question. You okay?
I'm perfectly fine.
Good.
So I don't want to give you 10 minutes.
Yeah. So in conclusion, if this board decides that something like the diabetes prevention programs or nutrition awareness for seniors and people in schools, which used to be funded, got reduced because of the pandemic, if we wanted to reinstate that, we would move a motion now asking the City of Toronto to fund that program. That's the way we would do it, right?
So through the chair, that sounds like reasonable process or appropriate process for the board. I would encourage the board, however, that it would be important to engage us as your staff and as your experts in respect of what makes a difference, what actually delivers on the outcomes you're seeking to achieve, and to engage us in that conversation rather than coming up with a program or suggesting particular programs on your own.
And wasn't that literally the purpose of the motion moved in November at the Board of Health meeting to ask you to provide us that information?
Sorry.
Wasn't that literally the purpose of the motion in November when we got the original service levels to ask you to provide us with that?
So through the chair, I'll let you determine what the purpose of your motion was, Councillor Perks, or the motion of the board. I would say this, though, that there is a lot of work that is happening at this point in time at Toronto Public Health to actually review that which makes sense to move forward. We can't bring all of it to you at this point in time, but it is very much an active project and something we're very keen to speak to this board about.
Thank you so much.
Thank you so much. Thank you. So go ahead. I know Councillor Malik got her hand up, but go ahead, Councillor Bravo.
Mr. Chair, just a point of order, please. Can I just remind you with respect to the time so that we keep track of time, please?
Yeah, thank you.
Thank you.
Show you my phone.
Please turn my clock on. It's just a quick question around, so if I'm hearing correctly, these programs haven't really been reviewed during this time of the pandemic, and I'm wondering if, as a new board member, the strategic planning process, if there is a relationship between that and looking ahead to what interventions are most important for protecting public health and preventing illness, injury, et cetera?
So through the chair, very briefly, yes. I think what we're most interested in bringing forward to the board is a comprehensive and reasonable approach to how we use our resources to achieve our overall objectives. And first and foremost, we're interested in, one, at the February meeting, conducting a proper orientation for the board, and then subsequently talking about things like what we understand of population health assessment. What are the issues that are actually facing our population at this point in time, for which we have purview as Toronto Public Health, and you have purview as the Board of Health. And then, you're quite right, moving towards, you know, a new strategic planning process, especially as we are emerging from the acute phase of the COVID-19 pandemic. I think we actually have a wonderful opportunity here to incorporate and to reflect on lessons learned from the pandemic, because we know it has had significant impact on the health of our population. We have a great opportunity to look at our data together to show you what we've got and what we would propose by way of actions and changes for the various service offerings of Toronto Public Health.
Okay. Thank you, Councillor Bravo. Councillor Malik, go ahead.
Thank you very much. So I appreciate the presentation. In the presentation, it said that there were 8 suspended programs. I'm sorry, I can only find 5 in this. Do you mind just listing out which programs remain suspended?
Sure. Through the chair, if you go to the appendices for the report, on page 1, there are 2 programs under the, in the yellow section, there are 2 programs under priority elementary school outreaches. Those 2, there's a 3rd one there under peer, youth peer leader training. The page 2, the diabetes prevention education. I just have to flip through a few. Page. My apologies, I wasn't expecting this particular question. Page 11. There are, the very bottom there, under disease prevention, under the tuberculosis education, there's 3 there as well. So that's 7. I don't want to waste your time, and you might have another question. So can I provide you the other 2? Just let me quickly go through it. Provide the other 2? Yeah, I think so. Sure.
That's helpful to get at least 2 more. And I guess can you speak a little bit more to what happens to these programs? Do they just, and this is maybe to Councillor Bravo's point, do they just remain suspended till there is another review of service levels? What happens to them? And I know it's difficult to say all the choices that are made to, you know, leave these particular programs in this status, but if there isn't a way to be able to just say a little bit about what happens to them as we move forward, and a little bit about maybe what characterizes them to remain in a suspended state?
So through the chair, let me try to address the question, and you're right, it's difficult to exactly predict how things will unfold in the future. But at this point in time, you know, as we are emerging from the most acute response phase of the pandemic, we are reactivating and reanimating programs that had to go into a more quiescent phase or to stop altogether because of redeployment. And we do have a number of our staff still redeployed to COVID-19 work. That being said, as we are able to provide people back to their original portfolios, that is happening, and that's what's been reflected in the presentation. That's why you're seeing a number of different programs fully recovered. As we, again, move out more and more out of the acute phase, we are returning people back on an ongoing basis to more fulsome public health programming. That being said, I think it's beholden on all of us to constantly evaluate and review our activities and ensure that the resources that we have available to achieve public health objectives are being used in the best way possible. That has to take into consideration a population health assessment, understanding what the needs are of our population, and as well understanding what is the evidence in respect of what we can do to substantively move or change the health situation as determined by that assessment. So that is a conversation that we would bring back here. We have recommendations, and we will continue to develop recommendations as we have in years gone by, based on our assessment of the population's health, based on some requirements that are articulated by the OPHS, by the province's standards, and as well based on whether there is an intervention that is actually doable and within our purview for us to do. So yes, we're moving people back to their original work, but as part and parcel of good, responsible practice, we're constantly assessing and reassessing what it is that we're doing. And I think that COVID has certainly offered a really unique opportunity for us, because it has been such a disruptor, and that's the downside of it. There's no question, as I mentioned earlier, it has really taken a lot out of us as an organization. But I think on the plus side, there's an opportunity to revisit that which we're doing, that which is driving health in the city now, and what we as your local public health staff can actually do to address the current needs.
Okay, thank you.
Sorry, and when you do have those 3 other programs, I'm interested.
Thank you. Any directors online have a question? Director Mulligan, go ahead.
Yeah, one quick question. Dr. DeVille, we've seen announcements today at the provincial level about, moving public money into for-profit healthcare facilities. Do we have any concern that this will have an impact in the short or long term on the amount of funding that's directed to public health from the province?
So through the chair, not having heard all the details, I can't be certain, but I will say that in general, health care, clinical health care tends to eat up the lion's share of funding that's available within the health system. Public health is a rather small player when it comes to healthcare funding, sometimes fluctuating anywhere between 1 and say maybe 3 or 3 and a bit% of the total funding envelope. So of course we're always worried as the small player within the health system, but I can't say that I know specifically what the recently announced changes might hold for us in the future. Of course, we'll keep an eye on that.
Thanks.
Okay, thank you. Seeing no other questions, oh, sorry, Councillor Thompson, my apologies.
Thank you. Mr. Chair, through you to Dr. Davila, and I've heard the questions that you're being asked, and recognizing the aspect with respect to Section 9 and discretion and the role of public health in terms of promoting and protecting, the health and safety and well-being of all Torontonians and so on. My question to you, Dr. Davila, through you, Mr. Chair, is that public health doesn't operate, though, in a vacuum. Would you agree?
Through the chair, yes, clearly we are part and parcel of our community.
Right. So there are other departments, for example, that are working on initiatives that does have a health and protection aspect, and it may not be medical and clinical in terms of the strict nature of public health, but it is nonetheless in terms of helping promoting the well-being and health of Torontonians, such as SSHA, such as FDSA, and so on, in terms of some of the initiatives that they are working on. So my question to you then is, how do you align in terms of your preparation and working on matters that you have discretion on that relates to public health, that also has an impact in terms of connectivity and coordination and collaboration with initiatives that are being taken within the context of those respective departments that I've just identified?
So through the chair, I will try to keep this answer relatively brief. You're absolutely right. I think what you're speaking to, Councillor Thompson, is are the social determinants of health. We know that which gives rise to health and creates and maintains health are things in the main that are outside of healthcare.
Right.
Elements like housing, income, social connectivity, air quality. These are things that are outside of the purview of healthcare, but that actually have very significant impact on the health of our population. So when it comes to how we work with our city partners who have more direct purview on some of these key social determinants of health, it is an active conversation. I don't know that there is one singular way in which we work with other partners, whether they're city divisions like SSHA or SDFA or transportation or planning, nor is there a singular way in which we work with other relevant community stakeholders, community agencies and partners. You know, there is a conversation that needs to happen, and our role is to bring the best available science to bear, the best available evidence in respect of that which advances health objectives to bear, recognizing that many of those factors that most influence health are outside of our direct purview. We seek to influence our other partners.
Right, and I could add economic development to that as well, as part of the feature. Okay, great. Those are my questions, Mr. Chair. Thank you. Thank you, Dr. Bill.
Thank you. Seeing no other question from directors, you know, I should have actually asked Councilor Perks to go last because you had a question in private, right? Okay, so, all right. Let's start with yes, can I have a motion to go into camera, please? All those in favor? All those opposed? Carried. Okay. It's going to camera.
Hello, everyone. This is the board secretary from the city clerk's office. I'm going to read a statement for those that are connected remotely via WebEx. The board is now going to move into closed session. We will first suspend the live portion of the WebEx live stream. Anyone that is not needed for the closed session is asked to disconnect from the meeting. If you need to address the board after the board returns in public open session, please monitor the meeting on YouTube or on www.toronto.ca/council and reconnect once the board is back in public open session using the same meeting connection details that were provided to you earlier. Please note, if you do not disconnect from the meeting, you may have difficulty reconnecting with your ID. The WebEx recording has been suspended. Members, please do not begin any discussion until we advise you. Thank you.
And now we're at, okay, we're not recording yet. Okay, it's fine. We've got to get the recording going. We're good? Okay, we're good to go. Wonderful. Thank you. So, any directors want to speak on this item? I don't see any. No one? Going once, going twice, going... Okay. Councillor Perks wants to speak to this item. So, Councillor Perks, you have the floor.
Thank you very much, Mr. Chair. I'm not going to be able to support the 2003 Toronto Public Health request to the City of Toronto for its budget. I feel that we've hit a point in the City of Toronto where many of our hopes and ambitions about how we will provide support to each other, the kind of city we want to live in, and who benefits from our expenditures and who doesn't, isn't something that I can support anymore. At the beginning of the pandemic, there were a lot of conversations about how, knowing the crisis we were about to enter, we needed to build back better. And at the same time, there were changes at the province of Ontario in terms of the legislation governing public health units and the funding from the province of Ontario to local health units that put a series of constraints on what the province was willing to contribute and what fell exclusively on the local municipality. As a result of that, many things that we did prior to the pandemic, many of the ways that Toronto Public Health contributed to the well-being on a population level of Torontonians, many of the services directly to vulnerable Torontonians were temporarily suspended. And that made perfect sense. It made sense that in the middle of a global emergency, we reallocate staff to deal with that clear and present crisis in the City of Toronto. But it is now the third year since the beginning of the pandemic, and this budget doesn't build those services back. In fact, in some circumstances, we lose them, and lose them, I feel, forever. I can't in good conscience support building back worse. So as a matter of conscience, I'm going to have to vote no on the allocation request that is in this report.
Any other speakers? Councillor Bravo?
Speaking to what my colleague, Councillor Perks, just said, I think that I share the concern that that public health is one of the most important areas of the city for the most fiscally prudent investment that we can make. I also am concerned that I understand staff have presented the best scenario, but within constrained financial circumstances. So while I don't want to be prescriptive about how to deliver particular programs, I do think that as a new member of the Board of Health, I'm looking for us to return to the place where we were investing in social determinants of health and making sure that equitable health outcomes was the driving mission of Toronto Public Health. So I know there's a lot of expertise in Toronto Public Health and with the Medical Officer of Health, and staff can do that well. I do think that it hurts the future of the city when we don't provide adequate funding for one of the most important investments that we can make in terms of saving public dollars down the road and keeping people safe, and also just focusing on the people who are most harmed by systems and structures by design, who are more sick, more vulnerable, and more marginalized than ever. So I have to agree with Councillor Perks that while I 100% support the work of Toronto Public Health staff and leadership, I do think that we are investing in the wrong places around enforcement as a city, and this is the place where it belongs. And I would like to see that we actually provide more resources to you to do your job so well rather than less.
Thank you, Councillor Bravo. I'll say a few words on the item as well. Oh, sorry.
I had my hand up.
Go ahead. My apologies.
No problem.
Councillor Thompson, go ahead.
I just want to start my time. It's at 2:14, yeah. I'm happy with 12 minutes, of course.
I need to get better about the time.
Thank you very much, Mr. Chair, through you. First of all, I want to just thank Dr. Davila and her team and their leadership in proposing a budget for submission as part of the 2023 Toronto Public Health budget, and it's the service levels. Mr. Chair, there is never a time that anyone is happy with any budget that I've experienced. This is perhaps one of the worst times for us to be happy with the budget. In fact, given the need has been expressed, we've gone through 3 years of COVID, we've had huge challenges and so on with a variety of things, quite frankly. You go into the grocery store, chicken's $27. I went last night and purchased 9 clementines, and it was $15 and change. I've never seen that sort of thing before. Food prices are just out of this universe. We still have an obligation and a job to keep people safe and to ensure that, you know, the service levels and standards are at a level to be able to protect our vulnerable residents and to ensure the health and well-being of our citizens and our city and the residents. The challenge we have is that in order for us to add more to the budget and the funding that's needed, we have to tax our way to it because we're not getting as much as we need from the other levels of government, and we need to ensure that we advocate and we you know, speak to the challenges and speak to that in a way that's going to help us to ensure that we get the type of resources that we need. We've heard from Dr. Davila that she wants to evaluate, she wants to work with her team to look at what can be done more efficiently, what are the things that we need to do more of. There's an evaluation process that she's talking about. I think she termed it as an evaluation review that's going to take place and so on. And I'm willing to give her that time. I realize that people are still impacted and hurt by all that's actually happening in our community, in our society. And yes, it was and is an objective of us to build back stronger, build back better. We have to find the necessary resources to make those, you know, positions and the desire a reality. We are still challenged, and there's a lot of work to be done. We're dealing with homelessness issues in this issue in this city, and in this agenda, we're talking about ensuring that we have the ability to provide, you know, 24/7 warming facilities and so on. They come with an expenditure associated with. There's a lot of work that's being done at economic development. Just last week, we looked at a variety of different ways at SDFA, SSHA, and others, and how we work with the hospitals. The doctors all came in to say, you know, this situation where people are coming to us and using our facilities as a warming center and so on. It's challenging and so on. So this is just to say that there are so many complexities associated with all that we're trying to do. And when you look at situations, and just recently we had the FIFA, the World Cup, $200 billion was spent on putting on such an event. And if we had access to at least a portion of that money, we could actually have the golden luxury services that we all want in our city. But of course, we don't have access to that and so on, but it's just a comparative aspect in terms of priorities. Our priorities are still to ensure that we help people, we provide them with the the best level of you know, health and protection, and to ensure that they have a quality of life that is desirable and so on, but we know we're still challenged with respect to being able to afford many of these things, and all of our different services are challenged with respect to their inability to afford this. And so there's a real need for us to advocate to, you know, the other levels of government who have more money and more capacity to be able to generate monies than we do. I'm looking at my time, I'm fine. We are challenged. We don't even get 1% of the sales tax, which would help us immensely. So, Mr. Chair, I am supporting the budget as it's been presented by Dr. Davila and her team. Thank you. 5 minutes.
Thank you, Councillor Thompson. I was going to make a comment myself, but you know what? I think all three councillors who spoke, I think, conveyed my sentiments I was going to make remarks to. So I will pass for now. So seeing no other director wanting to speak on this item, I'm going to ask for the vote. Ask for a recorded vote. Okay. Clerks will do that.
Thank you, Mr. Chair. This is a recorded vote on item HL 1.4, motion to adopt the item. When I call your name, please indicate your vote. Director Bowery is absent. Director Bravo? Opposed. Director Lipretti, your vote, please.
In favor.
In favor. Director Malik? Your vote, please. In favor. Director Mantis, your vote, please. Director Moyes, or Chair Moyes, my apologies.
In favor.
Director Mulligan, your vote, please.
In favor.
Thank you. Director Perks, your vote.
Opposed.
Opposed. Director Thompson, your vote, please. Thank you. And Director Johnson?
Favor.
In favor. Thank you. That motion carries, 7 in favor, 2 opposed.
Okay, thank you. That carried. Okay, thank you. Let's go back to item 1.3. I believe Director Mulligan, you had a motion to bring forth?
Yes, I do.
Okay. Staff's going to put it on the screen. And you could speak to it whenever you're ready.
Okay, this is very likely my last Board of Health meeting, and I wanted to make sure that those of you on the new board have all the information that you need to keep good oversight over all the layers of public health protection against respiratory viruses. Not just vaccination, but also, I think maybe most importantly, ventilation and also masking. So this motion just asks Toronto Public Health to come back to the board with an update on progress related to prior motions related to ventilation and masking.
There we go. Thank you, Dr. Mulligan. The motion can go, before we do that though, I just need to extend. Can I have a motion to extend? Councillor Bravo, all those in favor?
Sorry, point of order. Extend to what? Extend to when?
That's a good question, Councillor Thompson.
To complete the item, I'm happy to do that.
Let's extend till 1:30. Is that a good? And to complete the item.
This item, but we'll break and we'll come back.
Yes.
Yeah, okay, thank you.
Thank you. All those in favor? All those opposed? That's carried. Thank you so much. The motion's back up for consideration. Director, Councillor Ventas.
To the mover,
Yeah, go ahead.
what is the time frame that we're looking at for the request for the update? I mean, I don't see a time frame on the motion.
We could add a time frame. I would ideally like to see this at the next board meeting.
But is this
Yeah.
the information that we're requesting, is it a research that is being conducted at the moment, so it will take time, or is this information that is readily available and that we just need to present at the next Board of Health meeting?
Well, staff will have to speak to how available it is, but my assumption is that it will be available, that they can give us an update on what they're doing with respect to each of these.
Okay.
Thank you. Staff can respond. Go ahead, Dr. Davila.
So through you, Mr. Chair, the wording right now suggests the earliest possible opportunity. Certainly, with these two different motions, I'm not going to guarantee the next Board of Health agenda. We do have a very fulsome agenda for you. You'll recall that's your first meeting with the new citizen members, for which we've planned an orientation. So I'm not certain that we're going to be able to include this as one of those items, but certainly we can bring something back as per the motion wording at the earliest possible opportunity for the board's consideration.
Okay. Any other questions? Okay. Seeing none.
Mr. Chair?
Yes?
Sorry, this is Trust Ida Lepretti. I was wondering if you could take the vote separately, because I'd like to vote in favor of A, but I will be voting opposed to B.
Okay. That's fine. We'll start. Seeing no other questions, we will start the voting on this. We'll break it up. All those in favor of A? All those opposed? Carried. All those in favor of B? All those opposed? Okay, that's carried as well. And back to the main motion. Yeah. Okay. So all those in favor with on the main motion? All those opposed? And that's carried. All righty. So we on a motion to go on break till 1:30? Or should we? We're going to go to break until 1:30. Recess till 1:30.
Mr. Chair,
Before we,
order, please.
before
Point of order. I understand that Dr. Davila has to leave at 1:30. I'm happy to stay and listen to the deputant until such time. Then we could break after that if we need to. But they've been here most of the day.
Yeah.
I'm happy to hear them.
Okay.
If it's the will of the
If
committee.
it's the will of the committee, I'm happy to stay as well. Okay, good. How are we online? The director's online. You're okay with this? I know some of you have to go back to work as well. Okay. Even though I'm working currently. All righty. So let's put item 4 on the, get my notes here. Yeah, item 1.6. Thank you.
So basically,
All right, let's get started. Let's continue. So this is item 1.6. And there's no presentation, so we're going to go right to deputations. So the first person on the list is Jacqueline Vincent. Are you here? And reminder, you have 3 minutes to speak. We have...
Can you hear me?
So one moment. So we have 12 people on the list, so you are one of 12. And you have 3 minutes. Go ahead. You may start.
Okay, perfect. Thank you. Hi, my name is Dr. Jacqueline Vincent. I'm a physician working at St. Michael's Hospital, primarily in mental health. I'm here today to speak in support of the recommendations from the counselors and also to advocate for my patient's survival. I'd like to read a couple of excerpts briefly from a CBC News article dated almost a year ago, January 31st of 2022. The title of the article is Toronto Hospitals See Increase in Cold-Related Injuries as Shelter System Fills Up. Some excerpts from the article include the following. Some people experiencing homelessness are spending 2 days in the emergency room on the hallway floor, and others have gotten frostbite on their fingers and toes. A doctor quoted says, "I saw a man who lives in his truck with his animals, and he had a kerosene fire in his truck, and his hands had second-degree burns." People are doing anything they can to stay warm. St. Michael's Hospital has seen a rising number of people come to the emergency department with injuries such as frostbite, foot infections, and hypothermia. The doctor quoted also mentioned seeing trench foot frequently, and please know that the trench in trench foot is a reference to World War I trenches, where the phrase first came from, and it can develop in less than a day in above freezing temperatures. I wanted to quote this article because it strikes me that almost nothing has changed in a year, and things have actually gotten worse in some ways. The waitlist for affordable housing continues to grow. Shelter spaces continue to shrink, including the dissolution of many shelter hotel spaces. And my patients are more and more desperate for safe, affordable housing, which is one of the primary social determinants of basic health. My question today is simply this: why are we satisfied with having the same conversation over and over? Why are we satisfied with holding a discussion to discuss basic human rights, such as not freezing to death on the street, the way at least 4 people did last year? Why are there so many of my colleagues, healthcare providers here, taking time out of our days to say to you, please let my patients live? Please do what you can to help my patients keep their fingers and toes and feet intact. Please do what you can to prevent me from seeing any more patients like the one I did just a couple of weeks ago, whose feet were so badly frostbitten they could not walk for days. Please help my patients keep themselves and their belongings warm and dry during wet, cold winter days. All of the healthcare providers who are present and who sent in deputations are here because we took an oath that at its basic foundation we do no harm and we preserve life. And the city's policies as they stand are doing harm and risking life. So I am speaking in support of opening warming centers at 0 degrees, opening 24/7 respite space for the overflowing shelter system, keeping existing shelter hotel spaces open, leaving encampments alone. It's simple. Thank you.
Thank you for your deputation. Any questions for the deputant? Seeing none. Thank you so much for that. The next person is Raghu Vengopal. Please correct my pronunciation if it's wrong.
Thank you, Mr. Director. I'm an emergency doctor at 3 Toronto hospitals for the past 16 years. I'm a general emergency doctor, and I don't have a special interest in social issues, and I'm not an expert on homelessness, but I'm driven by conscience to come to speak to you today because I attest to you, I witness an alarming rise in the number of homeless people seeking shelter from the cold in the emergency room. I attest to you, Mr. Director, that cold weather is deadly. This year, I had 1 patient found outside with a core temperature of 29 degrees, requiring active internal rewarming, and he survived. Without the attention of Good Samaritans, this man would be dead. I attest as a full-time emergency medicine physician that the weather does not have to be -15 for people to suffer injury and death because of the weather. Many of my homeless patients have substance use issues, mental health problems, diabetes, respiratory problems, peripheral artery disease, limiting blood flow to their extremities, and these conditions mean they cannot tolerate the cold as you and I can, Mr. Director. Many of my homeless patients seek shelter and do not have money and are not dressed appropriate for the season. I attest to you that I witness on a daily basis patients that cannot find a warm place to stay, so they come to the emergency room. As you know very well, Mr. Director, the ERs are already overwhelmed. On a regular basis, I see patients in the waiting room, in chairs, and standing at the nursing station. In the ER, a homeless patient is given a chair, but I attest to you that they are so tired they sleep on the floor. Sometimes we have no juice and sandwiches, so I offer them a glass of water. The overwhelmed Toronto hospital system cannot provide adequate care for these citizens. They come after our social worker has left at night. They usually, due to a lack of space, are ushered out of the ER before the social worker comes in the morning. I have called central intake multiple times with a patient recently, and no one picked up the phone after I tried over and over again. I see online medical records where patients go from one ER to the next, having been seen by social workers. I attest that the current system of warming centers does not provide the stability that people need to put their lives back together, to stabilize themselves, and they are bouncing from ER to ER. As a doctor, I emphatically tell you that everyone needs some place to be for their physical, emotional, and psychological health. These patients taking an ambulance to hospital and seeing me as a doctor is a poor use of our public funds. Better shelter options not only is the right thing to do, but it is the smart thing to do as it saves public funds. I readily admit to you, Mr. Director, seeing me as a doctor overnight is not a good use of public funds. I attest that patients who are homeless come by ambulance, using that precious resource when they do not need it medically. I want to conclude, Mr. Director, with one story that a patient last week I had went into a Walmart and vandalized the store simply so he could be arrested. He was brought to the emergency room in handcuffs by police, and his only request was for food and shelter. Thank you.
Thank you. Any questions for the Deputant? Councillor Malik?
Thank you very much for being here and for sharing your presentation. And I also acknowledge that you shouldn't have to. You know, in the short term, you described some of the needs of your patients and also what we have to do at the systemic level. Can you give us a breakdown of what those recommendations are that we should be taking forward?
Thank you, Councillor. I base my recommendations on my clinical experience and not because I've been fed ideas by anyone else, but these are born from my own conscience. Number one, we must immediately open respite and warming centers 24/7. Number two, we must expand the number of respite and warming centers. Number three, the dates of respite and warming centers must be open at least from the beginning of October to the end of May, although I acknowledge I'm not a full expert on the exact dates. Number four, the city's criteria to open respite and warming centers must be reviewed immediately with input from nurses, social workers, doctors, and harm reduction workers. And lastly, Mr. Chair, I ask that we declare a public health emergency, since currently and on a regular basis, citizens cannot find shelter with existing resources, and citizens must turn to the hospital system for shelter, and declaring, Mr. Chair, an emergency will crucially improve the intersectoral collaboration between agencies and actors to find, please, durable solutions to this serious situation. Councillor, in your deliberations with your colleagues, I would ask you to reflect on a saying that I learned in a war-torn country called Central African Republic, where I worked with Doctors Without Borders. The saying in that country in the African language of Sango was zo kwe zo. That's zo kwe zo. And what that means in Sango is that each person is a human. And I would ask that you and your colleagues bear that in mind when we think about our fellow citizens, as that fine line between homelessness and being housed is very thin.
Any other questions for this deputant? Seeing none. Thank you for your deputation. The next person is Dr. Stephen Wang. I can't see the directors.
Hi, my name is Dr. Stephen Huang, and I'm a physician specializing in internal medicine, and I've been practicing at St. Michael's Hospital for more than 25 years. I'm also a professor of medicine at the University of Toronto, director of the MAP Center for Urban Health Solutions at Unity Health Toronto, and a research scientist with a focus on homelessness, housing, and health. I've become increasingly concerned about the health and well-being of unhoused people living in Toronto this winter, and so I'm here today to speak based on my clinical experience and research as they relate to the Board of Health motion that you're going to consider. As we know, the number of people in Toronto who are unhoused has grown dramatically over the last few years, putting increased pressure on the shelter system. Every night, more than 100 people who request shelter through the city's central intake system are unable to be matched to a bed. I've seen this in my own practice, taking care of patients who are admitted to the hospital. Over the past month, I've had many patients in the hospital who were unhoused. We treat their medical illnesses, helping them to get better to the point that they are ready to be discharged from the hospital. only to be faced with a lack of shelter beds to send them to. This creates an impossible dilemma. Do we discharge our patient literally to the street into the cold after having labored so long and so hard to help them recover from a serious illness? Or do we keep them in the hospital for another day in the hopes that a shelter bed will become available, knowing that the same thing might happen again the next day, and also knowing that we have many newly admitted patients sitting in the emergency room waiting for a hospital bed to become available? In our hospital, like others across the city, we're seeing an increase in the number of people who come to our emergency department simply seeking a place to get warm. We're seeing many unhoused people with cold-related injuries such as frostbite and hypothermia. And in the past month, our emergency department has taken care of people with these conditions on nights when it was warmer than -15 degrees centigrade. In 2019, I published a research paper with colleagues about the effects of cold weather on hypothermia among people experiencing homelessness in Toronto. For our study, we reviewed coroner's records and emergency department records from 5 Toronto hospitals over an 11-year period. Our study had 3 main findings. First, people who are homeless account for 25% of all hypothermic injuries in Toronto and 20% of all hypothermic deaths in our city. Secondly, while the risk of hypothermia increases in extreme cold, even moderately cold weather puts people who are homeless at risk of hypothermia. In fact, 72% of hypothermia cases in people experiencing homelessness occurred when the temperature was warmer than -15, which is the current threshold for an extreme cold weather alert. And thirdly, cold snow and rain amplify the effects of cold temperatures, increasing the risk of hypothermia. Our research suggests that the current state of the housing, shelter, and respite and warming center systems in Toronto leave many people at risk of injury and death due to the cold. Preventive health measures such as providing safe, accessible, low-barrier warming spaces, developing evidence-based criteria for the opening of warming spaces, and increasing the capacity of the shelter system so there are enough spaces for everyone who wants a bed are necessary. I see these as essential public health steps, and I encourage the Board of Health to move these recommendations forward to Council with your support. Thank you.
Thank you. Any questions for the Deputy? See none, thank you. Next on the list is Diane Chan McNally.
Thank you for the opportunity to speak today. Toronto is a winter city, yet every single year we seem to be less and less prepared to address the impacts of the cold on our most vulnerable people, people who are experiencing homelessness. And at the same time, homelessness, we know, is increasing every single year. As a point of fact, in 2018, City of Toronto opened walk-in access 24/7 winter respites in 8 locations across the city. The overall capacity at that time was 660 spaces, and by February, that was increased to 900 spaces. Since then, many of these spaces became respite or closed respites, meaning that you have to call central intake in order to access a bed. You could no longer walk inside. This is still the case. So even though the pandemic, we have spaces where we can go inside again, yet the shelter system remains entirely closed for people to actually walk in. People can't find anywhere to go, and we know this. Moreover, today, we have an estimated 18,000 people in the city who are experiencing homelessness, and yet we're only operating 3 warming centers. 3. We used to have 8, and we used to have 900 spaces. Today, we have 112, and they're only opening up when the threshold is -15 degrees or colder, or -20 degrees with the wind chill. As I said, Toronto is a winter city, and people are stranded. But as we know, people do make their own shelter using whatever tools and resources are at their disposal, setting up encampments, sleeping on the TTC, and as we heard, actually going to ERs, feigning illness in many cases to go into the ER. To be sure, when we do not offer warm indoor space, people do what they have to do to survive. They are in survival mode, and we are pushing them to do this. This does come at a cost, and we know this as well. It comes at a cost to services like the TTC and hospitals who are experiencing crisis, as you've already heard, to shelter people that we will not. Is it fair? Is it accountable for us to place this expectation on them? Or, more importantly, is it fair? Is it accountable to download the responsibility onto people who are homeless themselves in order to survive on our streets? We could do better, but right now we're choosing not to. Toronto, again, is a winter city, and exposure to the cold is a public health crisis. On Christmas Eve, despite conditions we know can kill people, we failed to enact an adequate response. Somebody died. Their name was AR. They died in an encampment in North Etobicoke, and they froze to death. That's on us. There is a clear disconnect between Toronto Public Health and SSHA. Toronto Public Health declares an extreme weather alert, SSHA enacts a response, but there is no clarity or consistency between the two. The protocol is unclear, and moreover, it is inadequate because, as we know, as we've heard from other deputants, that minus 15 degrees is just not adequate. Toronto is a winter city, and we need warming centers now. We must revise the protocols for opening warming centers in consultation with the medical officer of health, and we must create walk-in access 24/7 spaces now. Toronto is a winter city, and we must act like it.
Thank you. Any questions for this deputant? Okay, seeing none, thank you so much. You go ahead.
So why does it matter that the walk-in nature? Some argue that it's better to have a centralized system and with more wraparound care. What about the ability to walk in is so important from the expertise that you have working with this community?
Well, we know that not everybody wants to actually access a shelter bed. They feel unsafe. There's lots of different reasons why people may not want to do that, not the least of which could be COVID, but also things like theft, assault. Having a very low barrier space ensures that people who do not want to actively access a shelter bed have somewhere to go. For all the people who are sleeping on the TTC, who are in hospitals, a lot of them have actually even given up on trying to access shelter space. So we actually need to recreate some kind of space similar to what we had in the past. Again, that is very low barrier walk-in access so that anybody, no matter what situation of homelessness they're existing in, can access the services that are inside and just the warmth itself.
And my last question, Mr. Chair, thanks, is we've heard so much that people are turning to 24-hour restaurants like Tim Hortons, and that in fact, emergency department staff are providing gift cards to get people indoors. Is this a site like these, even though it's a private business, where we could be reaching people? Like if this is, I don't think that we should accept that situation, but are we at the place where 24-hour restaurant chains are actually a de facto shelter space?
We are absolutely at that point. If we go to Tim Hortons, McDonald's, you'll actively see that predominantly, especially at night, people who are there sleeping are people who are experiencing homelessness. So if you're talking about performing outreach, there's absolutely a site we could be doing this. But again, it's unfair to actually put the onus on these private businesses to shelter people when it is our responsibility. So they're doing that for us, which is completely inadequate. And we also know, because it's not a public city space, people are often criminalized for being there. You cannot use the bathroom. Unless you buy something, you have to leave. So that becomes a barrier in itself, and people can be removed from the space as a result.
Thank you.
Oh, okay. Thank you, Mr. Chair. Through you, thank you very much for your presentation today. I'm just wondering, from your perspective, what is the role and responsibility of the provincial government in terms of this issue? It seems to be a lot more complex than just a Toronto-focused issue. I mean, we have folks coming in from other places than Toronto for shelter. I'm just wondering if you had a position on that.
I think that's actually a bit of, I don't think that's actually happening. I'll be honest with you.
You don't?
Every city across Ontario says the exact same thing, and we've heard this if you look at news reports. Every city, Hamilton, Guelph, they will report that people are coming from other locations. Now, the thing is, we do have encampments across Ontario. People go to where the services are, and yes, Toronto happens to be a hub, but anyone who lands here we still have a responsibility to them, same way we have responsibility to people who are refugees. So to say that because they are outsiders, I think is a poor argument. And
I'm not making an argument with you, ma'am. I'm asking you a question because I've found a number of people who have expressed that they've come from other places to Toronto because of the services that we provide. But what I wanted to ask you with respect to a question, obviously your organization is quite diverse and you have expertise. I understand you're an author in some of these issues and so on. I'm wondering, have you looked at other municipalities in terms of the types of facilities that they offer in their area? You've just said you don't believe that folks are coming from those areas to Toronto, so I'm assuming that those other facilities have other facilities as well?
Sure, absolutely. You look at Ottawa, for example, we have warming centers there. There are other municipalities across the city, across the province, that do offer the kinds of spaces that we are arguing for today. So we're actually not meeting the minimum of other municipalities. Now, when you're talking about what is a province's responsibility, they have completely shirked their responsibility on homelessness, and that is clear. So a lot needs to be done to advocate to get the kind of funding that we need broadly to address homelessness across the province, not just Toronto alone. Sure. But we actually enact the shelter system. We have a responsibility as well. And earlier you were talking about revenue, for example. What about a 1% sales tax at the municipal level? Something like that.
We've been advocating for it for some time, actually. I've moved motions in the past.
There you go.
We
have revenue tools.
Yeah, thank you very much. Thank you, Mr. Chair.
Councillor Perks?
Thank you. And thank you, Diana, for taking time to be here. There are a whole suite of different services provided by different organizations. Some of them are directly delivered by the city. Some are delivered by social agencies in partnership. Has the City of Toronto been increasing, keeping the same, or decreasing the funding to drop-in programs and other supports to homeless people through community agencies?
We've been decreasing that funding steadily. So in terms of daytime drop-in programs you're referring to, I know you're referring to a suite, but I can speak better to that. We had, in the past, 28 drop-ins that were funded by the City of Toronto. That's now dwindled down to 24. So we're funding less drop-ins, and the amount of money that was being requested by each drop-in, nobody got what they asked for. And in fact, the total pot of funding that was provided was actually less. We were all expected to reapply for funding last year, and what we were given was about $3.9 million as a funding pot. Previously, we had 7.57. So that's a significant reduction in funding for daytime drop-in services. And what we've seen is that people have reduced hours. They've closed entirely. You have to sign up for a program, which is to say it's no longer drop-in access, so it's higher barrier, which again puts the onus on places like Tim Hortons, libraries especially during the day, TTC, hospitals, in order to shelter people.
Thank you.
Okay, Councillor Malik.
Thank you very much for your remarks and for your responses to the questions. As has been mentioned and you raised, there are a number of spaces in the absence of 24/7 drop-ins where people are seeking warmth, and they are welcome not in the absence of those types of spaces, but not appropriate. What types of spaces are the types of spaces that would be appropriate for the 24/7 drop-in, walk-in types of service that is required, and who should be supporting in the opening and administering of those services?
Are you literally asking what kind of facilities?
Yeah, well, what spaces is it? Is it community organizations? Is it city-owned spaces? Like what should we be looking to as the types of spaces where we have to kind of think more expansively about how we address this issue with the urgency it requires?
Well, I think if we look at like civic spaces that are in the portfolio, we know that there's not a lot. So I know right now with warming centers, for example, a lot of those are being operated by community partners. So Fred Victor, Margaret's, others that I'm not occurring off the top of my head. So we do that in partnership with agencies, and now a lot of those agencies do have space themselves. I think there's potential to explore a relationship there, but I caution, there's been a lot of talk about out of the cold, for example, and I caution that that's not the model we need to move back toward. So for the interest of people's knowledge, Out of the Cold was a program that began in 1988. that was being run out of church programs on a voluntary basis. So they only received funding for, I think, maybe 3 out of the 30-odd years that they were operating. And it's inadequate to ask a faith-based organization, volunteer-run, to essentially take on the responsibility of sheltering people. That is not any different, really, than relying on something like a library or the TTC in order to do it. So appropriate space would be city-run space or in conjunction with an agency partner in the community, not volunteer-based, properly resourced with things like showers, meals. So there would need to be facilities, I think, ideally for that. That, again, could be within the building portfolio of community agency. You could ask us, we could talk about it at All Saints, but I feel like that would be the most appropriate space.
Okay, thank you. Seeing no other speakers, thank you. Kathy Crow is next. Thank you.
Hi, everybody. I think I know most of you. If I don't, I've been a street nurse for 35 years. Been here a lot on this issue. I'm really glad you're speaking about this issue today. And I'm a former Board of Health member, so I know your challenges. 26 years ago, on a Sunday morning, a Toronto Sun reporter phoned me to tell me that a homeless man had been found frozen to death in an above-ground parking lot on Adelaide near Simcoe. His name was Garland Shepherd, or Noof. I guess he came from away. Then City Councillor Jack Layton was in my co-op that morning. He hammered out a press release on my computer, and then City Councillor Olivia Chow sent it to the media. Jack then joined me at the parking garage site where Noof was found. Why? Because it was -20 that night, and the city had not called an extreme cold alert or open warming centers. We held a press conference calling for an improved system. Why? Because only a few months earlier, what is known as the 3 freezing deaths inquest had completed, and a city task force, which I was on, had established a cold weather response plan. The plan was dysfunctional then, and you're hearing how dysfunctional it still is. And by the way, everything we're saying applies to the extreme heat alerts and cooling centers. Please deal with this today. I support a review, and health and dignity need to be taken into consideration, not warehousing. Over the years, we've had to beg for alerts to be called in inclement weather, because the city's threshold, as you're hearing, is impractical and dangerous. In fact, Toronto got away with not opening warming centers for about 10 years until a homeless man named Richard Kenyon died in front of the old Maple Leaf Gardens during an ice storm in 2013. This was quite embarrassing because the city had opened emergency warming centers for the housed population that had lost power for many, many days that Christmas season. And I visited those sites. And I'll tell you, they looked very, very different than the sites that the city would operate for unhoused people. We've had to fight over the years for just about everything, and I'll just give you a short list. We've had to fight, and still are, for an adequate number of centers, for mats and enough cots, sleeping options for people who cannot get down to a cot. We haven't won that. Enough blankets, pillows, accessible washrooms and showers. We haven't won that. Privacy. Metro Hall lobby was used for years. Adequate food, as in 3 meals a day, including at least 1 hot meal a day. We don't think we're there yet. Healthcare on site or support. Harm reduction staff. Free TTC during heat and cold alerts. So we need standards, and those standards should surpass refugee camp standards, which we are not even meeting. So I'm supporting very much the recommendations, your attention to look at this item. There needs to be a review. I would urge you to add cold alerts and heat alerts, do it together. I want to close, though. I'm almost done. I have 2 more sentences. I want to close by addressing the mayor and his staff. I say to you, stand down. Stand down. Let the humanitarian response take place that I know staff are capable of and would wish to do. You are micromanaging this file. Mayor Tory, I know you're listening, or your staff will tell you what I said today. You should declare a right to shelter in this city and make it your priority and your moral value for your next 4 years as mayor. Thank you.
Thank you, Kathy Crow. Any questions for the deputant? Okay, seeing none, thank you so much. Next person is Sabrina. I think the last name may be Sutherland, based on the email address I see here. Is there Sabrina here? Okay, seeing none, we'll go to the next person. Melissa Goldstein. Melissa Goldstein? Nope. Okay, next, Victoria Joseph.
Thank you so much for giving me this opportunity to speak. We are all parents, and some of us are becoming one. We are not immune to this situation. Life happens. But we are here to do what we can to make things work out for those that need them. My name is Victoria Joseph, and my son is homeless. He's living in a male homeless shelter right now. One thing he said to me yesterday when I met with him was, "Mom, there's a lot of drugs happening here." He was diagnosed with bipolar. He was diagnosed with bipolar almost 2 years ago during COVID lockdown. He's currently receiving treatment at Camp H, which is an improvement from the struggle we've had. Now that he has agreed to take medication, he has nowhere to stay. He's very optimistic. I see it in him. He told me, "Mom, I'm gonna start looking for a place." But when he got to the shelter, they told him it would take him a month to speak with a representative in regards of affordable housing. And it would take him 10 years to assess one. He needs a meeting with the housing worker right now before it's too late. We don't have 10 years. He's finally agreeing with treatment. My fear is he's going to get discouraged because of the wait time and the environment he's living right now. We need help. I pay my taxes every year, so does he. But now he's in a standstill because of his condition. I do not want him to fall through the cracks of Toronto homelessness, because it's going to get to a point where he starts believing no one cares and he's comfortable where he's at. He needs a chance to get his life back. And just to be clear, I'm not here for just my son. I'm here for every young man out there that is able and can, but due to health issues, they can't. They all need affordable housing. As we all know, rent is very unaffordable. It is very difficult for a young man just coming out of school to be able to pay $1,000 or more for a shelter accommodation. Now you think about it, a young man with mental health. We need help now. We need a place for them to call home so that they can assess their treatments with encouragement and hoping, and a lot of hope. But if we just leave them out there in homeless shelter, after a few weeks, it's gonna be worse. They're gonna just join the whole group. Not everyone in homeless shelters are bad or are unable. They want to, they are willing to, but they are discouraged because of what they see around them every day. I need help for my son. He's a responsible kid, never been in trouble. He needs your help. I need your help.
Yeah, thank you for your deputation. Any questions? And thank you for the heartfelt deputation. Any questions for the deputant? Okay, seeing none. Thank you, Ms. Joseph, for coming in today.
And let me just point out, he's in your district, Mr. Councillor Mons.
My staff will be happy to speak with you and get you information.
Thank you so much.
They're actually over there. Mr. Greg Cook? Mr. Greg Cook?
Okay, yeah, just unmuting. Hi, thank you for this opportunity to speak here today. My name is Greg Cook, and I've been a drop-in worker and outreach worker for 14 years. I've had the honor to get to know and walk beside hundreds of people who are unhoused during. I'm regularly impressed and convicted as I observe the generosity and kindness that people extend to each other as they make sure that their friends have enough food and warmth in this expensive city. Times people take food for an elderly friend from a drop-in or offer someone their only sweater on a cold day is truly astounding. When the government and our unequal economic system has abandoned you, each other is often all you have. Yet the city keeps destroying the temporary shelter that people make for themselves and each other. The health impacts of the rising number of people displaced from housing and extreme weather that they have to deal with because there's no respite is really concerning. The life expectancy of women who are unhoused is 35. For men, it's 48 years old. What is it for the general population? Dr. Farmer, in his book, Pathologies of Power, writes, "In this increasingly interconnected world, we must understand that what happens to poor people is never divorced from the actions of the powerful." Councillors, Toronto's Mayor, John Tory, each of you have a lot of decision-making power here today. You have been elected to make important decisions for the welfare of the people in this city. The Board of Health has profound responsibility for the health of the residents of Toronto. Today, you have the opportunity to make a decision that will help people stay warm, that will enable people to survive. Please make sure the warming centers stay open all winter. Just before the holidays, I was doing outreach with a colleague near Metro Hall. The warming centers had just opened. It was cold. Freezing rain was hitting the sidewalk, and people trying to sleep. They were covered in wet sleeping bags. We walked two men to the warming center who had soaking wet sleeping bags. They didn't know it was open. Please, if they are open all winter, people will know they are open. They won't have to play a guessing game. Please make the ethical decision here. Paul Farmer goes on to say, for me, an area of moral clarity is you're in front of someone who's suffering and you have the tools at your disposal to alleviate that suffering or even eradicate it, and you act. I sit here today asking that you think for a moment about what people have to endure to survive in a city where housing is much too expensive, where the emergency shelters are full, and people in the hundreds crowd over heating grates and ride streetcars all night to make sure they don't freeze to death. Today, at your disposal, you have the tools to alleviate some of that suffering. I'm requesting that you act.
Deputant? Okay, seeing none, thank you so much for your delegation here today. Next is Dr. Maggie Hulbert. Dr. Maggie Hulbert. Okay.
Hi, can you hear me?
Yes.
Hi there, this is Dr. Hulbert. Thank you for having me. Am I okay to start? Perfect. Okay, I see the clock thing, so I will. I present to you today as a physician as well as a community organizer. I work with Health Providers Against Poverty, and together with representatives from the Shelter Housing and Justice Network, I want to make sure that the board here is aware that we have drafted an open letter which has been signed by over 1,700 people, including more than 600 healthcare providers and frontline workers. I want to make sure the board here is aware of our demands, which I will read now. The first demand is opening the warming centers between September 15th and June 1st every year when the forecasted temperature for the day is 0 degrees or lower, and ahead of inclement weather, including freezing rain or snow. This was also supported by, as you heard in Dr. Stephen Wang's incredible deputation earlier and all of his research. Please ensure livable conditions in these spaces, including access to hot meals, washrooms, showers, proper sleeping spaces, as well as social work supports, and a minimum of 250 spaces of these will need to be downtown. Please reinstate lower barrier 24/7 respite space until the shelter capacity is below 90% as per the Toronto shelter standards. Keep existing hotel shelter spaces open and add at least 2,700 more non-congregate shelter spaces. Stop the eviction of encampments and the destruction of survival gear, and collaborate with all levels of government to build 10,000 rent geared to income units immediately and 90,000 additional units to address the growing wait list. I've submitted this letter to the written record as well, including all the signatures. And I just want to say I'm trained in psychiatry and mental health, and due to the overlap of mental illness and homelessness, many of my patients do not have a home and they rely on city services, including warming centers. I've seen so many people who've lost parts of their body due to the lack of warm spaces available downtown. These are wounds that people carry with them for their entire life. This adds to the enormous trauma experienced daily by people experiencing homelessness, which further worsens existing mental illnesses and contributes to the vicious cycle of poverty. And I want to make it clear that every Board of Health member here has the ability to make an effort to interrupt this cycle, which is such an incredible power, and I really urge you to consider acting on that today and adopting these demands. Providing safe spaces during extreme weather is one very important step. Thank you, that's all.
Thank you, Dr. Halbert. Do we have one, Councilor Bravo would like to ask a question?
Thank you for the deputation. We heard from Dr. Huang about the physical injuries that happen when people are experiencing homelessness, and given your area of expertise, I wanted to ask you about how homelessness might affect people's mental health, just being without a place to call home. And I'm thinking that while we've heard that definitely having a mental illness can lead to homelessness, we know that there are many people who are just losing their housing because they can't afford rent. There are people that are working full time and are homeless or staying in a shelter, riding the subway. So how does it affect a person's mental health when they don't have a place to call home?
Thank you so much for your question, Councillor Bravo, and sorry, my apologies, I just realized I could turn my video on. I think there's such an enormous trauma that's associated with experiencing homelessness, and you're right, while people with mental illnesses are I would say overrepresented in the homeless population, there's also a cycle of experiencing homelessness would put you more at risk for having mental illnesses. There's enormous amounts of traumatic experiences which would predispose somebody to PTSD. And then as well, it's very difficult to access healthcare, access psychiatric care, psychological care, which is first line for a lot of mental illnesses receiving psychotherapy. So people experiencing homelessness also aren't able to access the standard of care for mental illnesses. I personally have seen numerous people with PTSD due to experiences related to not being able to access shelter, having frostbite, relating to some of the, just the desperation and anxiety that goes on with being able to constantly not know if you're going to be able to survive. So I absolutely think that homelessness worsens mental health, undoubtedly. And we also know that people with mental illnesses are more likely to get cold injuries. So I think this is a population that is often, the marginalized of the marginalized. So it's something that is very concerning. And I'm not sure if Dr. Wang's research looked at people with mental illness specifically, but there is a large database on people, especially with serious and persistent mental illnesses like schizophrenia, being more at risk for cold injuries.
Thank you.
Thank you. Any other questions from deputants? Seeing none, thank you so much for your deputation. Next is Douglas Johnson Hutlum. I was told you're online. Are you there?
Yes.
Okay, you may start your deputation.
Thank you. I would like to begin my deputation by correcting the record on 2 items that have been stated or stated repeatedly by members of this committee today or in recent days. The first is that from the most recent street needs assessment put together by the City of Toronto itself, most people, this is quote from the major items, most people experiencing homelessness are Toronto residents. 90% have lived in the city for more than 1 year. A second thing that has been said repeatedly is that people are refusing help, and that's why we have encampments. The reality is that 9,711 people in this city are actively homeless, according to the minimum figure from the City of Toronto in its shelter flow data. And those people only have access to just over 9,000 spaces now. It was less than 8,200 spaces on November 17th, but with the rapid increase, we still are short being able to sleep everybody in the city by about 650 or 700 beds, even all the people that are at minimum acknowledged to be homeless by the City of Toronto. Today, before beginning this meeting, I had to search desperately and still have not found a friend who I know to be encamped in a spot that there was a major fire for. His name is John. He's a veteran of Toronto, of Canada's war in Afghanistan. We recently committed spending $70 billion on fighter jets over the next 40 years instead of dealing with homelessness of people like Mr. McNamara. I don't know where he is yet. I don't know if he was affected by the fire. It is untrue to say that he wasn't seeking, he wasn't receptive to shelter. I have a record of text of him begging for me to get him into a shelter hotel. He knows he wouldn't do well in a congregate setting with his PTSD. And I don't know whether he's made it out of that fire alive or not. He was trying to keep warm. He told me he was having trouble keeping warm this winter. Over the course of 2022, a previous speaker said we had at least 4 freezing deaths. By my count, it was at least 6 people found frozen in death, though I cannot speak as a non-medical person to the cause of death in each circumstance. We know that at least 2, the weather contributed. We know that at least 3 of those individuals were either racialized or transgender. And I know in particular, in one instance, key instance, I will not speak to which one for privacy issues, that the person was in a remote location having tried for months on end to access shelter space in either Toronto or a nearby city, and had been rousted from their location encampments 4 times by police, and ended up in a very remote location and froze to death on a week where we had to lobby hard to get cold weather alerts called. I therefore support this motion and think the temperature should be lowered or raised dramatically, during which time an extreme cold weather alert is called. Thank you.
Thank you. Thank you, sir. Any questions for deputants? Okay, seeing none. Thank you, Mr. Hartlem. The final deputant is Miguel Avila. You have 3 minutes. Hello, Miguel.
First of all, I want to comment my disappointment about cutting down the It was very inappropriate. But anyway, you're learning. Good for you. You know, I live in Ward 13, and I'm a grassroots activist. I'm not going to repeat what previous deputants have expressed, suggestions, ideas, recommendations. And we all know that the 3 levels of government have failed. And that's the result of the homeless crisis in this city. Since the day of Tent City, I have seen this problem over and over and over. And now we're seeing that not opening the warm shelters spaces during this time is wrong. Is probably considered a luxury. You know what a really luxury is? It's the increasing of 200 police officers to the Toronto Police Service budget. That is a luxury. We don't have that kind of money to do what the mayor wants us. And I'm here to wear proudly my Defund the Police t-shirt because I want to annoy John Tory, the mayor, because he thinks that it's a laughing matter, that this idea of defunding the police is wrong. But I gotta tell you, John Tory, I didn't vote for you. Nobody elected you to increase the police budget. This problem that we have is because we haven't prioritized our budget money correctly. We are not putting the interests of the people first. We're putting the interests of the rich ahead. You know, those 50 special constables officers that are going to be hired by TTC, what are they going to do? They're gonna go out to the poor people and ask them for hey, how you pay your fare? Or where are they gonna take them to find housing? There's no places in Ward 13. And you know that, Chris, you have walked the streets. So, Chris, I want to encourage you to continue speaking louder, please, about the reduction of the police services budget. I'm here in support of the letter submitted by Councilors Malik, Bravo, and Gore-Prex, because we need to do some action before more people are dying on the streets. Last week, on Tuesday, we honored another more members to the list of dead people on the streets, and that shouldn't be happening on a rich country like Canada. Instead, we should be taxing the rich, because that's the problem that we have in this community. We're not doing enough to tax the rich and pay their dues this city needs so we can have that money to escape poverty. Thank you, Chris, and congratulations on your chairman position.
Thank you, Miguel. Any questions for the deputant? See none. Thank you for coming in.
You're welcome, Chris.
And now we can move on to the directors. Questions to staff. So who'd like to ask questions of staff? Okay. Councillor Thompson?
Thank you very much. Is there anyone from SSHA here? Looks like Mr. Tanner is here.
Oh, yes, just here virtually, Councillor.
Yes.
So, Mr. Tanner, you have heard the deputations, and you've obviously been working in the file for some time. I'm just wondering, how many people are accessing our warming centers currently that you're aware of?
Through the chair to you, Councillor. So we've been had the warming centers open for the last 3 days. We have a total of 112 spots in those locations, and we were 7 people over that. So we had 119 people using the warming centers last night.
Right. You are working on a report that was requested of you from the Economic and Community Development regarding shelters and sort of looking at the future and update. You are working on such a report?
We will be working on that report. It was a motion moved at the Economic Community Development Committee last week, and so we will have a report back to that committee in April.
Okay, and looking at all the challenges and opportunities, looking at ways to make the system more efficient, I gather?
That's correct. This will be on warming centers specifically, with the review of the current threshold for their activation.
And would you be looking at a timeline in terms of when they could be open till as such, as part of your report?
Yeah, I think we'll put a comprehensive review and analysis and try our best to answer some of the questions that have been raised about their activation.
May I then ask, on one of the recommendations here in terms of the motion, number 3, it looks at declaring a public health crisis. What exactly does that mean? What are the service levels that we would see that would be different in the types of investment? And I don't know if you are the one who have all the answers to that. Maybe Dr. Davila may be able to help as well. I'm just wondering, what does that mean to you, and how would we respond to providing, obviously, whatever resources are necessary? Because you told me that you've got about 100+ people that are in need of warming center. I'm just wondering, have you looked at a population matrix to determine what the additional numbers would be? I mean, there are 2 parts to my questions, right? I don't know who's
So maybe through the chair to you, Councillor, I'd only answer the second half, maybe defer the piece around a public health crisis to Dr. Davila. But, certainly we recognize the demand for our services continues to be very high. The shelter system is running at maximum capacity, and when we open our warming centers over the course of 3 days, they are reaching their capacity.
And so through the chair, with respect to calling something a public health crisis, there is no formal structure in law or in legislation or in practice, in fact. I mean, I think there are a number of issues that are characterized as health crises in our city. We've heard, I think, a number of deputants speak to the crisis within healthcare settings, in our emergency rooms. There are certainly people who have talked about all kinds of health crises in our midst. But what I would suggest, again, as I have many times to this board, and I think what Mr. Tanner is suggesting, is that we, work with the, we've got a review process underway, and when it comes to that which is affecting the health of Torontonians, I've put forward to the board that we are interested, as your staff here at Toronto Public Health, to actually show you a population health assessment that does consider, of course, the different circumstances, including those who are homeless here in Toronto, and what we would put forth by way of action that should be prioritized. We certainly do have lots of priorities, and those who experience mental health challenges and actually addressing from a public health population level mental health challenges is part and parcel of one of our priorities.
So I'm hearing you correctly that irrespective of what's being asked here, and if we were to approve that, nothing will fundamentally change? Is that what I'm hearing?
So,
as far as calling this a crisis, if we deem this to be such.
So through the chair, there is nothing prescribed in terms of action that follows up the terminology of public health crisis, but certainly from a public health practice point of view, your staff at Toronto Public Health are constantly assessing that which is impacting the health of Torontonians and seeking to put forward actions that we can undertake, and then of course suggest and influence actions that others can undertake to address those health challenges.
So this is ongoing?
Yes.
Thank you. Thank you, Mr. Chair.
Okay. Thank you. Anyone else?
Okay.
I'll just,
Yes, of course.
sorry, were you going to ask something too? Okay. I guess my question refers to, clearly there's no like statute or regulation that's being invoked by speaking the word crisis, but I think, isn't it true that over the decades since the public health movement started, it wasn't always evidence that came in the form of formal evidence that gave rise to the kinds of interventions that Toronto Public Health champions? And, I think of environmental disclosure bylaw. That was a community effort to say we have the right to know where toxins are being stored in our community. So maybe I'm asking you, but I'm referring to Councillor Thompson's question, which is that if we don't speak it and name it from a governance perspective and increase a sense of urgency, perhaps then as a Board of Health, we're not fulfilling our duty to ensure that from, as citizen members and as councillors, we're bringing forth what outside community expertise is telling us, or what we experienced. Myself today, I saw 2 people sleeping on the subway who clearly, we're not in the most vulnerable state, but we're sleeping on the subway. So that's my question, is like, don't we have a governance imperative as well to name things that we see, that we hear from the street, from community, from doctors, and from our own residents?
So through the chair, Councillor, I would suggest to you that the governance imperative I will certainly leave to you and the members of the board, as governance is within your purview. There's no question that there are many things that we can characterize as crisis. I just want to be clear with the board that there isn't anything in statute or in law that ensues by using the terminology public health crisis. I agree that there are many urgent issues that require attention, but just want to be very clear around, what one might expect either in statute or under law as a result of using certain terminology.
Thank you, Dr. Davila. Understood.
Okay, thank you. Councillor Perks, I think you're...
Thank you. One of the recommendations in the letter that we're considering is to ask you to convene a table including physicians, health experts, people with lived experience, to investigate the relationship between homelessness and health. I was wondering if you could give me two things. First, is that something you welcome? And secondly, are there health impacts beyond even exposure to cold simply by virtue of being homeless?
So through the chair, very briefly, the answer to the first question is yes. I welcome the opportunity to have that tabled. It's an important discussion to speak about, the impact of homelessness on health. And on the second question, you're quite right, Councillor. There's no question. It's not just about temperatures. We know that the health of people who are homeless and underhoused is without question worse, right? Simply because they are homeless and underhoused. Every imaginable condition is worsened by not actually having sustainable, affordable, supportive housing. So there's no question that housing is a fundamental social determinant of health. No question in my mind about that. So, and it's not about a specific temperature. We know that unfortunately, homeless individuals in our city, we have a homeless death data initiative. We know that those who are homeless and underhoused in our city die at much younger ages than what is expected for those who are housed, and that there are significant challenges, no question, and significant impacts of homelessness on health.
Thank you.
Yeah, thank you. I have a few questions. First of all, to you, Dr. Davila, have you and your team undertaken work in collaboration with SSHA to review of the intersection of health and homelessness?
So through you, Mr. Chair, there was direction that was received by my colleagues at SSHA last week. We are starting that work, but I admit we are not, far along down the road at this point in time. But certainly we do speak to our colleagues at SSHA around shelters and issues around homelessness and how best we can support them in their mission and in their service provision.
Okay. And are you aware of the motion I moved at ECD this past week regarding warming centers?
So through you, Mr. Chair, yes.
Okay. And just one final question to you. As the Medical Officer of Health, do you have the authority to declare public health emergency? I think you sort of referred to it already, but.
So briefly, Mr. Chair, no.
No, okay. And to, I think Gord Tanner's on the line, right? To you, Mr. Tanner, thank you. How does SSHA allocate staff to opening emergency warming centers?
Thanks for the question. It may change from season to season. I can tell you about this season with the 3 warming centers that we have in activation. 2 are operated by our nonprofit community partners, and 1 is operated by city staff. The staff are, on call, if you will, or on standby, monitoring the weather, and when an extreme cold weather alert is called, or when SSHA, out of an abundance of caution, given a number of other variables, may open those centers, we activate them with our community partners over the course of about 12 hours.
Yeah, thank you.
Mr. Chair, may I add to that? I just wanted to comment on the fact that when we look at the last cold weather season, about half the time that or half of the different occasions on which warming centers were opened in the last cold season, there was not an extreme cold weather alert. So in fact, I think my colleagues at SSHA are taking into consideration a number of other criteria by which to open warming centers.
And you alluded to this already, but why doesn't SSHA keep warming centers open 24/7 during the winter months? Is there a reason why?
Thank you, and through you, Chair. Currently the locations that we have, 2 out of 3 of them, aren't necessarily facilities that we would recommend operating 24/7. So for instance, Metro Hall does not have showers, a dietary kitchen, and other facilities. So these services are meant to provide a surge capacity to the shelter system when we have inclement or extreme weather. And as you know, we'll be reviewing, those criteria with your motion But that is, that's the reality. If we open the centers now, as I understand the motion asks, I think it's important that the board know they will fill up and they will likely be full within several days.
Okay, thank you for that. I'm happy to see that you're aware of my motion at Dev. Can SSHA relocate staff from other divisions to open warming centers like you did during the pandemic?
Thanks for the question. So yeah, certainly during the pandemic, I mean, we opened up to 40 different locations, I think, within the first 6 months. We had at the highest peak probably 600 or 700 redeployed staff from elsewhere across the organizations. You know, so that is something that we've done before. What we benefited from at the time was the declaration, I believe, from the province of a provincial emergency, which allowed us to do things with our bargaining agents accordingly, our friends and colleagues in Local 79 and 416. So, you know, that is a challenge, but I think what you're alluding to, I mean, the three challenges we have with the capacity come down to, first and foremost, staffing. Second, the appropriate kinds of facilities that we would want to activate and run on a continual basis over the course of a season. And the third part to that would be, you know, funding available currently within our budget to keep those operations going 24/7 throughout the whole winter.
Since I have a few seconds left, the province allowed the city to reallocate staff under this emergency. So is the emergency now over, or are we still in the emergency? That makes sense to you?
It does. And I would maybe defer this to Dr. Davila for a better answer with respect to the pandemic emergency, but it certainly provided us some flexibility with our unions.
So through you, Mr. Chair, the province declared the emergency over. So those provisions that Mr. Tanner was referring to are no longer applicable.
Oh, okay. Thank you for that. So my mic off, I'm still speaking. Seeing no other questions of staff, let's go to, sure, go ahead, Councillor Perks.
I'm trying to remember, Dr. Davila. I think it was 2019, I'm not sure, but the province of Ontario amended your emergency powers and constrained them recently. I'm trying to remember when that happened. They reduced the number of areas where you can declare an emergency. I think it was 2019, am I correct?
So through you, Mr. Chair, Councillor, I'm not sure what you're referring to. I'm looking to my colleagues who look equally puzzled. There were no specific powers of emergency declaration, and certainly no change. I'm looking to see colleagues, are there other thoughts?
I may be
missing
remembering
something?
wrong. I believe there were amendments to the Health Protection Promotion Act in 2019, which reduced some of the authorities that you had.
So I know that through you, Mr. Chair, that there may have been some changes that actually related to the Chief Medical Officer of Health, but not necessarily
Okay,
to.
there we go. That was my
us.
confusion. Thank you.
Okay, thank you. And so now we'll go to speakers. Who's up first? Councillor Thompson.
Turn my mic on. I have two motions. Wonder if the clerks can put them up, please. Mr. Chair, sorry, just wait for them to come up. Yeah, these are my two motions. I'm going to delete recommendation number 3 and also number 4. We've heard from Dr. Davila that the issue around calling this particular matter which is very problematic, very challenging. There are many people that are being obviously affected and impacted by the homeless crisis in the city and, of course, other cities across, certainly Toronto and across North America, quite frankly. So inasmuch as there's an effort to address this issue through the letter that's been sent to the Board of Health, we have 18 recommendations that's been put forward at the ECDC that speaks to addressing these issues around affecting homelessness in this city. We understand that there's more to be done. We've heard from Mr. Tanner. We've also heard from Dr. Davila that that work is taking place and so on. And I know that none of us in this room want anyone to suffer. It's not evident to me that based on what we actually have here is going to change the outcome as to what exists now. What is evident to me is that the work that we're asking Mr. Tanner and others to do through the motions that came from ECDC and the work that's being done by public health and the work that Dr. Davila has at her discretion to do, that there's efforts to address many of these challenges. It's not perfect. It's not perfect in Toronto. It's not perfect any place around. We know that in terms of the City of Toronto, we're providing currently about 8,000 spaces per night. We're looking at this particular budget in 2023, that number will go to 9,000. We know, and the letter here says that governments have not been doing what they should do. And that is not an argument here. We need governments to do more. We have also refugees coming into the city that are compounding this challenge, and we need to ensure that investments are made as well with respect to this subset of the refugee component, as well as the homelessness issues in this city. Yes, we need to have more facilities, but we need to do it in a coordinated way. It can't just be done on the fly, and Mr. Tanner is working through that process in conjunction with, social development and finance and so on. We know last year we actually saw the placement of about almost 4,000 people into permanent housing. That is the objective and goal, and that's the solution that we actually want. Permanent housing is something that we need. And so what actually is being suggested here is calling this a crisis doesn't affect the outcome, doesn't affect the immediate challenge that we have. We've heard that Mr. Tanner and team, they have the ability to address, obviously, opening up facilities, working in conjunction with respect to community partners as part of the activation. That's extremely important. That work needs to be done. We need to ensure that when we say that facilities, should open till April of any given period. In 2003, we had a big ice storm. So then we need to give the staff the discretion, and that work as part of what's actually being done accommodates that and so on. And as much as we're all pained by the challenge that exists in this city, and by the folks who've come to speak today. And I want to thank them all for coming here today to speak to us. And I understand the challenge with the TTC, the medical facilities and so on. One of the motions that I moved, which was recommendation number 9, was around getting Ontario Health to collaborate with others in terms of dealing with issues of people experiencing homelessness and so on, and to figure out how we address the needed care that's needed, and not to use our hospitals as a warming center, quite frankly. There's more that needs to be done. But I don't believe that what we actually have here as part of the item, HL 1.6 and the letter from the 3 members of council actually accommodates and allows that to happen. We've heard through the questioning, it really doesn't. I mean, I realize it's an exercise in terms of creating media, and I get that, because we need to bring media attention to it, create this advocacy.
Mr. Chair, I have a point of personal privilege.
Mr. Chair, I
have a point of personal privilege. As a member of this committee, I'm allowed to raise a point of privilege anytime I want.
Personal privilege. I just heard your interruption.
Thank you. Point of privilege.
Go ahead.
The member has ascribed a motive to the letter that myself and other members of this board submitted to you in an effort to try to disparage our motives, and I ask that he withdraw that.
So, Mr. Chair, my comment was that I'm not sure if that's what it is. I didn't say it was so.
I'm still making my point of privilege, asking that it be.
But I'm happy to withdraw it as well.
Yeah,
but
very good.
My point is such.
Please do.
Sure. Thank you.
Thank you.
May I continue?
Yes.
Thank you. So there's a lot of work for us to be done. It can't be done in this particular manner. It has to be done by the professional staff who we actually have who has a responsibility and care to do this work. I say that we give them the opportunity and the time to do it, and we've heard that what is being recommended here today, what's being asked for today, is not going to be done in the manner that it is being prescribed here today. So I don't think that we want to create this sense that something action is going to be taken today when it doesn't. We have a plan to deal with it, and we need to stick to that. Thank you, Mr. Chair.
Okay, thank you. Councillor Perks, you're next.
I had some questions of the mover.
Sure, go ahead.
Thank you. Councillor Thompson, given that the two motions you're recommending be deleted do much more than simply ask that there be a declaration of a health crisis. For example, it suggests that this board call for the immediate provision of 24-hour respite space. Additionally, it suggests that, and this is the portion you want to delete, that we look for a variety of new kinds of spaces, including with community organizations, faith-based groups that would provide low barrier walk-in access. Am I to take your motion deleting these that you don't think the Board of Health should collectively and express an opinion on those points?
Thank you very much for the question, Councillor Perks. Councillor Perks, I do focus on ensuring that community organizations, facilities, and locations in the number 4, that those be incorporated as part of the work that the general manager of SSHA and others will do. I think that if the conversations that we've had at economic development, which I think was very wholesome, also speaks to the issue of looking at 24/7 facilities to ensure warming centers are available. But we also heard from the general manager that he has at his discretion to be able to activate facilities when needed. So I think it does help, as well as those agencies that are providing additional support and services in terms of ensuring there's that collaboration that takes place. So it seems to address the issue from my particular perspective, Councillor Perks. Through you, Mr. Chair.
That was my question.
Okay.
I'm prepared to speak at any time.
All right, so Councillor Perks, you're next.
Thank you. Mr. Chair, I think that after listening to the deputations here, and for those of us who've been listening to deputations like this for years, we absolutely must act now, and we must act in a way that creates leadership. There's a suggestion that if this body, the members of council and the members of the public who are appointed to steward and care for the health of Torontonians on a population base, declare something as a crisis, we're somehow wasting our time. And frankly, that suggestion shocks my mind. I can think of no other body that has a stronger obligation than we do as the people appointed to think about population level health in the City of Toronto, that we say, yes, we agree with you. We agree with the people who are homeless. We agree with the emergency care physicians. We agree with the people who are frontline workers in this. And we agree with the people of Toronto generally that there is a crisis. And I think that us taking on the moral obligation to say that and say it out loud does several important things. First of all, it validates the voices of people who are homeless. One of the things that has distressed me in the last 8 years, is the gradual narrowing of the public conversation, reducing the size of council, cutting off community tables where council was given advice, giving stronger powers to one individual, the mayor, to decide what's important in the City of Toronto and not. It is fundamental to democracy and to the health of the people in our democracy that we validate those voices and open up the spaces for people to make comment. Now, in terms of Councillor Thompson's motion, I have to caution you. I think it's very, very unhelpful. I think we as a body need to take that responsibility to give advice to the general manager of shelter, housing and support that we as people who are appointed to think about the health of Torontonians feel very strongly that there should be 24/7 low barrier access and that it should be extended to April 15. If Mr. Tanner feels he doesn't have the resources to do that, our advice may encourage him to tell council what resources he needs to accomplish that. It's an important contribution to the conversation that we tell Mr. Tanner, from a health point of view, this is the right action to take. Now, if we were members sitting here today as members of the Community and Economic Development or the Budget Committee or the deputy mayor or anybody advising the mayor, we might think, oh, there's a money problem too. That's not the piece we're being asked. We have heard from emergency doctors, we have heard from frontline workers, we have heard from people who are homeless, we have heard from the medical officer of health that being outside in the cold is unhealthy. We have heard being homeless is unhealthy. And we have a duty, an obligation, a moral obligation to tell Toronto City Council that's a crisis and you should act immediately to solve that crisis.
Question for... Oh, sorry. I should probably pay attention. Go ahead.
I am going to agree again with Councillor Perkson to say this is my second time being on the Board of Health, and my experience previously was that we are in a unique position on this board, not only to listen to the medical expertise that can look, do prospective studies and do population level studies and make recommendations based in science, which are crucial, but also to listen to the kind of knowledge, expertise, and advice that we got today through these deputations, and which were echoed at the Economic and Community Development Committee. What we heard is that things are worse today. This isn't just business as usual, that there's been a surge in homelessness and people becoming homeless who are working full-time or just lost their housing. It's just complicating a situation that was already difficult before. I think we have the obligation from our governance perspective to share with the other departments, with the Budget Committee, with ECDC, and now with the Mayor's Office, who has a lot more power in the new governance structure, that what we're hearing from people in the community and experts is that people are becoming more ill. It's putting pressure in all kinds of places. There's no part of this city that isn't impacted. One of the freezing deaths was in North Etobicoke. We're talking about homelessness in Scarborough. There's no place that isn't touched. Toronto Public Libraries, the Toronto Transit Commission. Anybody that rides transit every day can see it. People are turning to transit as a form of shelter and housing. And that's not good for transit riders. What we have done during this time, however, is turn towards surveillance, enforcement, and reactions and responses that put people into the pipeline to the criminal justice system. And it's shocking to me to hear from a doctor saying that people are getting arrested on purpose so that they can they can be indoors and get a meal. These are not fiscally prudent choices that we're making. So I would set that aside. They're actually more costly. But I do think that in terms of the particular mission that the Board of Health has, is that respecting people's fundamental human rights, the notion that people have a right to housing and shelter, and that these are drivers, crucial, probably the most important driver of good health outcomes for people. And the disproportionate disadvantage that certain groups are experiencing it's unacceptable. And I think that if we don't call it what it is and name it, we don't get action. I think about the early sounding the alarm around climate. Oh, you're talking about a crisis. Or around violence against women. Oh, you're always invoking a crisis. Well, it is a crisis. And if we don't name it, we're not going to do anything about it.
Okay, thank you. Any other speakers? Councillor Malik?
I'd like to speak, but I also have a statement to share on behalf of one of the citizen directors who's not able to be here herself.
Let's go ahead.
So I don't know, how does that work? Would that come from my?
I will give you the time to do that.
So I'm reading the statement on behalf of Ashna Bowery. I'm sorry that I had to leave the meeting before these items were addressed and could not speak to these in person. As a primary care physician with a focus on homeless health and refugee and newcomer health at St. Michael's Hospital, I want to illustrate some of the challenges that my patients face. I would like to share the story of N, who was under my care for 12 years until he passed away during the pandemic. He had given me consent to share his story with learners, members of the public, or this board, if it would help people understand. N lived on the street for years before we were able to get him Toronto community housing, but more often than not, I would still find him sleeping on the street or at Q Beach or in the ER due to cold exposure related to illness. He never once allowed me to do a home visit because he was concerned about my safety. He never felt safe under his own room or in the shelter system. He was repeatedly assaulted, his medication stolen, his home vandalized, and his ceiling leaking and walls damp in the winter. The unit overrun with infestations of bed bugs, cockroaches, and rats. He felt safer on the street. How is this acceptable in the largest city in a G7 country? My friend and colleague, Dr. Katie Dorman, submitted a letter to the board to this effect, and I would encourage you to read the reflections of our patient experiences to help understand the real-life plight of our homeless population. With regards to funding options to support refugee housing challenges, I have had the opportunity to provide care in the hostels that serve as shelters for newly arrived refugees in the city. These shelters are shocking, grossly overcrowded, poorly maintained, and I have heard more than once that many have felt the conditions they face in transitory camps were preferable to how they are living now. Again, the status quo is not acceptable. I would support any recommendation that ensures appropriate funding to help already vulnerable people live in safety and dignity as they embark on their new lives in this country. On a side note, it has been an honor and privilege to serve on this board and work alongside fabulous colleagues like Dr. Davila and her TPH team. Thanks, and look forward to working with many of you in some way in the future.
Thank you, Councilor Malik, for reading that out.
You're welcome.
So you have a statement yourself you'd like to speak? Or like to speak? Yeah, do your thing.
Thank you very much. We heard a lot today in this meeting, and the most important thing that we heard and was implored upon us is that we have to look at this crisis with eyes open, right? That people who have been in this fight and in this work for so long, over a lifetime, are seeing that not just that things haven't changed over the last little while, but they've gotten worse. And we're seeing evidence of that in all the places that we inhabit as Torontonians, not just on the street, but on our transit routes, in our libraries, in our public spaces, and in our shared and private spaces, too, where economic development, where life happens in this city. We heard health professionals implore us to let their patients live. We had members of our community and people who've been doing this work implore us to look at each other as human beings. That is the level of this crisis, and that is why it is so important that we step up and into our responsibility as elected representatives, as people who were called upon as citizens of this city, to actually act and do something about what we see, because we know a healthy city is one that is more equal. We know that a healthy city is one where housing is treated as a right. We know that a healthy city is one where we care for each other, where we step up to our duty to protect each other, especially in a winter city, as was shared with us today. We heard today a parent like so many of us, what wouldn't we do for the young people in our lives? What wouldn't we do? What amount of money is too much to protect the people in our city to actually have a home, But today, we're just asking for a warm place to go. That is what we heard today. And we do have the power in this body to be able to take actions to actually address this issue for the long term, to bring together the working table that Dr. Davila so enthusiastically said yes to. We need to have the expertise, the lived experience to be able to get ahead of this crisis and not just return to these tables with the same issues over and over again. We need to be able to express the seriousness with which we have to take every step. We have to look at the public health crisis as an issue of economic development. We have to look at this public health crisis as an issue of the future of our city. And we have to be able to come up with solutions that are addressing it for the immediate term. We're going to be reviewing the policies around warming centers, which is so important. But we also have to be able to say to our community members, to our public health professionals, and to each other that we took the opportunity to act when we had it, to actually save lives, to make sure that people aren't forced to put their health and their safety in danger when we see the conditions that have been shared with us and that, you know, even our fellow board members are describing to us through their experience. This motion that we're putting forward is just the beginning of being able to address this issue, but being able to pass it, to give it the leadership that it requires, is actually going to get us so much further in terms of being able to save lives, to protect and be proactive in terms of people who are experiencing homelessness in our communities, and also to be able to show what is actually possible. I fully support this motion and the remarks that have been made around this table in that regard. I do oppose these amendments. I don't think I actually know that they don't get us further. And the concerns that were raised that these were looking to address, when I hear those remarks, I actually think that the original motion captures those concerns, as well as the work that Councillor Moyes has done in the Economic Development Committee to address those concerns with his motion. So together, we are able to make a powerful statement, and we're able to make some powerful actions to actually address this crisis with the urgency that it requires. And make no mistake, this is a crisis, and we have the power to do something about it.
Okay, thank you, Councillor Malik. I will say a few words. Let me set the clock. So as a former health professional, I know that the best cure to homelessness is a stable home. It's no secret. You know, we all ran on a campaign recently, and, you know, everybody had, providing more housing in the city, be it supportive housing, deep affordable housing, all sorts of housing. You know, housing is the key. And as alluded to, I did bring some motions forth at ECTEV earlier this week, and I know that the Medical Office of Health and the General Manager of SSHA, in conjunction with, again, with SSHA, they're looking at opening more warming centers with experts and physicians' advice. And I agree with all the things that have been said so far today. The deputants, you know, stated their opinions and their facts, and I agree with what they've said. I support what my colleagues have said around the table. It's common sense. But there is indeed a public health crisis when it comes to housing, mental health, and addictions. This is a joint crisis, and all aspects need to be addressed in order to solve the underlying issue. But also, too, it's important to note that the crisis we face is not only a Toronto problem. It is a GTHA problem, and I think we have to look at it. Some of the things that we have done over the last many years, you know, has been a Band-Aid solution. You know, I've said publicly that, you know, we could open 1,000 spaces tomorrow, and, you know, a week from now, those spaces will be full. So I think, you know, that we need to continue to provide space. That's our responsibility as a city, I believe. It's an obligation, it's a human rights obligation to do so. But also, too, we need to make sure that all regions of our community, all regions of this province, actually provide sustainable housing so people can actually, receive the help they need where they live. And so I hope that, with my motion at ECDC, those concerns will be brought forth as well. And I think in the long term, this will help mitigate the housing crisis that we're in. So I just wanted to say that out loud, but I will support the motion that is before me today. So with that, should we start voting? Okay, so we'll vote on Councillor Thompson's motion first. Pardon? A recorded vote. Okay. Okay.
Thank you, Mr. Chair. This is a recorded vote on the motion moved by Councillor Thompson for item HL 1.6. When I call your name, please provide your vote. Director Johnson?
In favor.
Director Bravo? Opposed? Director Malik? Director Mantes?
In favor.
Director Moyes, or Chair Moyes, I'm sorry. Opposed. Opposed?
Yep.
Director Perks?
Opposed.
Director Thompson? In favor. Thank you. The motion does not carry by a vote of 4-3.
And that was items 3 and 4? Okay, sorry. Sorry, I didn't hear you. Yes, I know that. But let's vote for seriatim, or one by one. Yeah. We just voted on Councillor Thompson's. Yeah. Yes, sir. Separate. Yeah, we are.
Turn my mic on. Point of order. How many members are on the board? Yeah. Because I can't see who's actually online. Pardon me?
Director Johnson's online.
I was just trying to understand the number of people.
There's 7 of us.
There's 7, all of us.
Yeah.
Together. There was, okay, that's fine. Okay.
We do. 7 is quorum. Yeah.
So we only have 1 member that's
Yeah.
actually online.
Yeah.
Okay, gotcha. Thank you.
Sure.
This is a recorded vote on recommendation 1 in item HL 1.6. When I call your name, please indicate if you are in favor or opposed. Director Johnson?
In favor.
Thank you. Director Bravo, Director Malik, Director Mantis,
Favor?
Director Moyes, Chair Moyes,
Favor.
sorry, Director Perks,
Favor?
Director Thompson. Thank you. That recommendation passes unanimously. Recorded vote on recommendation number 2. Director Johnson.
In favor?
Thank you. Director Bravo. Director Malik. Director Mantis.
In favor?
Director Moyes.
Favor.
Director Perks.
In favor?
And Director Thompson. Thank you. That carries unanimously. And now for a recorded vote on recommendation number 3. Director Johnson.
Opposed?
Opposed. Director Bravo.
In favor?
Director Malik. Director Mantis.
Opposed?
Director Chair Moyes. In favor. Director Perks.
In favor?
Director Thompson.
Oppose.
That recommendation carries by a vote of 4-3. And recommendation number 4, Director Johnson.
Opposed?
Director Bravo.
In favor?
Director Malik. Director Mantis.
Opposed?
Chair Moyes.
In favor.
Director Perks.
In favor?
Director Thompson.
Oppose.
That recommendation carries by a vote of 4-3.
Okay. And let's adopt the item as amended. All those in favor? Okay. Recorded vote.
I'm sorry, we just did it at Seriatim, there were no amendments, there's no, we don't need to have it.
Yeah, that's right. Sorry. Okay. Well, so that's it, right?
Sorry.
Yeah, no. Okay, motion to adjourn. Motion. Okay. Councillor Mantis, all those in favor? All those opposed? Carried. Thank you. It's okay.
That was rough. Normally, the chair script will come to you in advance, just so you know.
That'd be great.